Good afternoon. I am Ward 5 Councilmember Zachary Parker, Chair of the Committee on the Youth Affairs. Today is February 4th, 2026. We're meeting in person in room 500 of the John A. Wilson Building and virtually via Zoom. The time is now 2:04 p.m. and I'm calling to order this performance oversight hearing. And I want to thank all of those gathered here today. We were here from government witnesses, from the Child and Family Services Agency, as well as the Office of the Ombudsman for Children. Today's hearing continues the oversight the Committee on Youth Affairs has committed to since its establishment. Since that time, to better understand the child welfare landscape in the District of Columbia, my committee and I have engaged with advocates, youth with lived experience or elected leaders, neighbors, and agency personnel to identify both the benefits and issues with the district's child welfare system. Our efforts are continually guided by seeking to improve the outcomes for our youth and their families. Today, the committee will hear government testimony from the Office of the Ombudsman for Children and the Child and Family Services Agency as part of the Council's annual performance oversight hearings. As the committee responsible for general matters related to the care and well-being of juveniles in the district, with emphasis on youth within our child welfare system, as well as the rehabilitation of youth within the district's criminal justice system, the committee has engaged in robust oversight of CFSA and OFC throughout the year. This includes visiting various family success centers and collaborators, working alongside advocates and neighbors to craft legislation, and engaging regularly with CFSA and OFC leadership to understand real-time challenges and wins. With these performance oversight hearings, the committee seeks to build understanding and groundwork that we have built on the understanding and groundwork that we have laid to further assess how systems can be improved for children and families in the district. We will begin with the Office of the Ombudsman for Children, which is legislatively established as an independent, impartial office responsible to the council. The OFC is tasked with improving outcomes for children previously involved with, or otherwise known to the Child and Family Services Agency by holding agencies accountable for fulfilling their responsibilities under the law. Included in their statutory duties, OFC is uniquely positioned as an agency that can investigate crossover youth, as they have access to data from several district agencies such as MPD, OAG, and CFSA. It is my hope that with this access, we can begin to better understand the trends that influence a youth's involvement in both systems and create mechanisms that can help change outcomes for the better. We know from OFC's annual report that the number of youth who are involved in both the child welfare and juvenile justice systems, referred to as crossover youth, has been increasing year over year at a dramatic rate. In 2021, there were 368 crossover youth in the district. In 2024, that number nearly doubled to 670. Based on these numbers, it is clear that young people in the district are facing a crisis, and this committee seeks to understand how systems can be changed to create better outcomes for youth so that they may limit their system involvement and especially avoid becoming involved in both the child welfare and juvenile justice systems. My hope is that the committee can walk away from today's hearing with a clear understanding of how the public interacts with the Ombudsman's office, how the Ombudsperson contributes to the well-being of youth and families involved in the district child welfare system, and how we might scale the impact of that office. We will also hear testimony from the Child and Family Services Agency. CFSA works to improve the safety, permanency, and well-being of abused and neglected children in the District of Columbia, as well as to strengthen its families. My objective is to understand how the agency treats and supports youth in their care, while also focusing on a number of issue areas my team and I have identified as the focus for our oversight at this hearing and throughout the year. We will also explore CFSA's current programmatic offerings, how they are meeting the needs of the communities they are meant to serve, and how CFSA partners with district agencies and organizations to further administer those supports. Whether through improving the programmatic supports for relative caregivers, creating a new type of permanency for youth aging out of care, neglect code reform rights access for families in contact with CFSA, or creating more transparency to better understand CFSA decision-making, the focus has and always will be further refining the child welfare system so that it is best positioned to serve the people of the district. Of particular interest to the committee is the quality of care and support being provided to youth who interact with CFSA. The outcomes of youth who exit their care and the circumstances in which CFSA chooses to screen in a case. CFSA screens out an average of 1,500 hotline referrals per month. Further, work needs to be done to understand the reason for such a high rate of screenouts and to make sure that those families who are screened out are still connected to the resources they may need. Before we move on and begin hearing from our government witnesses, I just would also like to acknowledge this time and the trends that we're seeing in DC, where we are seeing a decline in violent crime and activity across the district, namely, and I was chatting with my team earlier, namely among our juveniles in particular. I referenced the crossover youth population earlier, but I'm also approaching this hearing looking for solutions, thinking about which programs are working, which activities are seeing success, and how we might scale them. I attended the Oversight hearing for the Department of Behavioral Health earlier today and was heartened to learn more about the Juvenile Behavioral Diversion Program, or JBDP. And, you know, the numbers that I referenced last, I think in 2023, they saw a recidivism rate of 11%, which is still too high. But that was down from about 24, 25% the year before. So to me, that says something in that program is working. And I received a commitment from Dr. Bazran at the Department of Behavioral Health to work with me and the committee to think about how are we scaling our supports for young people so that fewer of them are ending up in our child welfare system in need of support from our ombudsman's office or, sadly, in our Department of Youth Rehabilitation Services. So with that, I'm going to start with our first government witnesses. And I'm going to call our ombudsperson for DC for children, Katrina Jones-Jess. And before you take your seat, if you all can just stand and raise your right hand, as is custom for this committee and the council, can you attest or affirm that your testimony is going to be the truth, the whole truth, and nothing but the truth? Yes, awesome. You may begin with your testimony.
Okay, I think you can hear me now. Thank you so much for the opportunity. Good afternoon, Chairperson Parker and members of the Committee on Youth Affairs. My name is Katrina Jones-Jess, and I serve as the Ombudsperson for the Office of the Ombudsperson for Children. Thank you for the opportunity to testify today about the office's performance during fiscal year 2025 and to date fiscal year 2026. With me today is William Thomas, our Deputy CFSA Ombudsperson, and Antonio Baxter, who's our agency fiscal officer. And there are members of the team also in the gallery. The Office of the Ombudsperson for Children continues to build internal capacity, engage with the community and child serving agencies, and identify recommendations to help improve outcomes for DC's children and youth. This focus continues to be our guide as we address concerns with the systems that serve CFSA children and youth and make recommendations for improvements in policy, practice, and the availability of resources. It is our goal through today's testimony to highlight achievements, strategic goals going forward, and areas of opportunity. During fiscal year 2025, the OFC completed strategic tasks to further the work of the office and help improve outcomes and interagency communication in DC. For instance, per the office's enabling legislation, OFC is required to provide conflict resolution and mediation services. To meet this mandate, the OFC provided 2 employees with training in mediation skills and techniques, building capacity in that area. The office's enabling legislation requires the reporting of crossover youth data. To meet this mandate, the office worked collaboratively with CFSA, OAG, and MPD to access data sets relevant to identifying the crossover youth population. Further, the OFC identified an employee to run the data analysis, provided the employee with training on Tableau, and supported the process by implementing other secure tools. All the positions identified in the enabling legislation were filled during fiscal year 2025. The OFC creates a report about findings and recommendations based on an investigative case. These documents are provided to CFSA for their review and comment. We have worked closely with CFSA to close out or resolve recommendations made to the agency during fiscal years 2023 and fiscal year 2024. The OFC held 2 focus groups in fiscal year 2025 to hear from local constituents about their experiences while involved with the child welfare system. A focus group was held with relative caregivers in October 2024. Another focus group was held with youth formerly involved with CFSA in November 24. These focus groups were held after business hours to accommodate work and school schedules. Food and incentives were provided. Also, a child welfare professionals focus group was held in May 2025 to examine the child welfare system from a government and private agency perspective. In fiscal year 2025, the office received 104 complaints and concerns, the highest number since we began accepting complaints in fiscal year 2023. In addition, the office has identified critical areas for evaluation. Examples of areas currently being reviewed are the agency's hotline report screenouts and a secondary review process for child fatalities occurring while CFSA was involved with the family. Ongoing in fiscal year 2026, the office has identified several areas for further implementation that will enhance the services provided to DC constituents and inform improvements in the child welfare system. The OFC is looking closely at the time it takes to complete its investigations. According to OFC policy, the office strives to complete investigations within 45 business days. This was a voluntary measure designed and initiated to ensure OFC is responding to constituents timely. In fiscal year 2025, OFC completed 65% of the 51 investigations within 45 days. Creating more detailed data analysis to understand the experiences of crossover youth and informing recommendations to strengthen services is a priority. It is OFC's goal to expand the data reporting, including adding a qualitative review process at some point in the future. In addition, the OFC will advocate for the resources needed to produce required reporting independently. Hearing from constituents on whether they are satisfied with the services received by the OFC is important to us. We have identified 2 examples of customer satisfaction surveys as potential models. Further, we have initiated discussions with Octo about survey software availability and establishing the technical functionality to capture the survey data. It is the office's responsibility to receive complaints about administrative actions taken by the Child Welfare Agency from DC constituents in person, by email, phone call, or online. In fiscal year 2025, the OFC received a total of 104 constituent complaints. Most of the complaints were submitted using the online link, and complaints were primarily submitted by parents. It is the office's goal to continue to follow the pillars of Ombuds work and grow in knowledge and skill to help improve outcomes for children and youth in the district. It is a charge that we believe in and appreciate the opportunity to work collaboratively with the Committee on Youth Affairs to meet this goal. Thank you for your leadership, commitment, and time today. I'm happy to answer any questions you may have.
Thank you for your testimony. And it is good to see you. We learned we have a lot in common, by the way.
We do.
Anyway.
From the same part of the country.
Yes, that's right. I want to, before delving into my pre-planned questions, I want to ask some questions about your testimony.
Mm-hmm.
You say, per the office's enabling legislation, OFC is required to provide conflict resolution and mediation services. To meet this mandate, your office provided 2 employees with training and mediation skills and techniques, building capacity in that area.
Mm-hmm.
Besides that training, how often are those employees providing mediation and conflict resolution services?
We have not provided that service to individuals at this point. My hope is that through this training, it will get us to think more creatively and thoughtfully about how we can use this, use those skills to resolve complaints for, individuals in the agency.
Is that a
as well.
goal for this year?
Yes, yes, and going forward as well.
Okay. You also said, and then we talked about this, but I'm going to ask on the record that you are conducting 2 areas of evaluation. One is focused on analyzing CFSA screen out calls. The other is on child fatalities. When might we expect those analyses to be completed?
For the screen out calls, we expect to have a report completed by the end of this month. I'll defer to William regarding the child fatality, like his thoughts on the child fatality reviews.
Thank you, Chairman. So we're in the process of working with CFSA and their internal child fatality review team as they're revamping, and CFSA is going to share some information on that. But as they're revamping that process, we are looking at joining that internal review process around child fatalities. So far, we've decided to look at OFC is looking at child fatalities where there is a high profile type of child death. The agency has significant history with the child and the family. And so our intent and purpose of our reviews is to look at the level of services provided to the family prior to the death, to the
And it's
child
my
death.
understanding there are 5 deaths you're looking
There are
at?
5 where we
And I
have
was told
opened. We
2 of
completed
the analysis have been completed.
2 have been completed, yes.
Are you able to provide those analyses to the committee?
Yes, we did a summary of that the Ombudsperson can send to the committee to kind of
Okay.
give a brief overview of those reviews.
And for the other 3, what
The
I'm
other
taking
3
is that you don't have a firm date when
we
you
don't.
might.
Yeah,
Okay.
we don't.
And then you also say in your testimony, in terms of investigations in fiscal year 25, OFC completed 65% of the 51 investigations within 45 business days. You had noted earlier you had received 104 complaints and concerns. Of those 104, how many were investigated?
There were 50 investigations out of the 104.
51 investigations.
51, yes. that's
51
correct. Thank you.
And so all of those investigations were completed within 45 days.
So according to the data.
Because you're saying 65% of the 51. Oh, I'm sorry, I misread that. 65% of the 51. What is that math? Yes. So that's roughly 35 or so.
Yeah, I say that.
Testing my math skills here. So 35, that's clever. We use the larger numbers. So 65% of the 33%. 33 of the 51 investigations were completed in 45 days. What was the delta for the other, what is that? Number of investigations you conducted?
From the previous year, let me make sure I'm understanding
I
your
think it's
question.
the other 18. Do you have average time of investigation?
So we look at the data from 45 days or less or greater than 45 days. So I don't have that specific number.
Okay. Do you have what is the longest
Oh,
time frame it took for an investigation?
I'm sure there's been some that took a while. Yeah, we will provide you with that information.
Okay.
Yeah.
And then lastly, per your testimony, you say the complaints you've received from the office, the most that your office has received, which means more families are becoming aware, they're utilizing your office. Most of the complaints were submitted using the online link.
Yes.
And complaints were primarily submitted by parents, 50 of the 104 complaints you received. What were some of the other referrals? The other 54 referrals,
You want to speak to that?
Yes.
if
So,
not by parents?
yeah, so some of those were information and referrals, which are kind of relatively quickly resolved for constituents. Some of them are from foster parents, a few from foster youth, but the overwhelming number is from the biological parents or relatives.
Okay. Awesome. Thank you.
Mhm.
So for both CFSA and OFC, how I'm going to structure the questions, I'm going to lead with questions we heard from public witnesses, and then get into other pre-prepared questions. So on January 28th, this committee heard from public witnesses questions relating to how far back is OFC able to investigate a case?
So that's a great question. We've set a time frame around 5 years back is what we would prefer, because I think it keeps the information that comes out of the investigation more relevant, if you will. But of course, I mean, the legislation's not specific. It just says a history with CFSA, so.
And I know you mentioned the 104 contacts. Does the office do any proactive outreach to solicit feedback, but also maybe unearth concerns that parents have?
Yes. So we, for example, we did reach out to, we held those forums to hear informally from constituents about what their experiences were in the child welfare system, specifically with
And did any
CFSA.
of those forums, and I believe you said you did 2 of those,
Mhm.
Did any of those forums lead to investigations or other internal actions?
Not investigations, but they did lead us to, so for example, with the youth that we met with, and these were youth that were formally involved with CFSA, one area that they thought was important after meeting with us and through this forum was ensuring that other youth know that there's this opportunity that you can reach out to the Office of the Ombudsperson for Children.
That's a great segue. So another question is, does your office receive complaints from youth in the care of CFSA who are unhappy with their treatment or care?
We have received some.
Do you have a number for how
We
many?
we can get that for you. I know we're working on one right now, actually.
And what is the process if you receive a call from a young person to say, I'm with a family, or my social worker is not doing what they're
Mhm.
supposed to do?
Mhm.
What's your protocol there?
Yeah, so we've actually, Chairman, had youth to actually use the online portal to submit a complaint to us via that means and actually called our office. So much like any investigation, we reach out to the constituent to get a thorough understanding of their concerns to make sure that we are explicitly clear as to what OFC can do to provide support and to be clear on what their concerns are. Part of that investigation will include talking to collaterals, reaching out to CFSA staff that's working the case or working with the youth. And then it goes through that investigative process to see if there's any findings or recommendations that we need to make to improve practice or policy.
Okay, so you all will follow up with the number of complaints received by youth. Do you know if any of those 51 or however many investigations you conducted were per the
Of youth?
referral directly from a youth?
We can get that to you.
Mhm.
Yeah,
Okay.
I can tease that.
That would be helpful to know.
Yes.
It is our understanding that the Office of the Attorney General would have a file on both youth involved in the juvenile legal system, regardless if it is DRS or court social services, as well as a file on any open child welfare case. How has OFC worked with the OAG to figure out how the agency can better identify dual jacketed and crossover youth?
Mhm. So primarily over the last year, we have worked very closely with OAG to gain access to the data that they possess in order to conduct a cross-match of OAG data and CFSA data per the enabling legislation. So that required, multiple discussions and a lot of coordination to provide them with the kind of the guidelines that we were working from, and then also understanding what data that they're actually
Is
collecting.
it your understanding that you have the same definition of dual jacketed youth as the OAG?
That is not my understanding. I don't absolutely know what their definition is of crossover use. I will say that as well.
Okay.
We've been focused on the definition that is in our enabling legislation.
And your definition generally is any young person that is papered or petitioned by the Office of the Attorney General who has ever had a touch point with CFSA.
That is correct.
And
generally
this
speaking.
was a point of clarification for me. So originally I thought you meant a young person in the care of CFSA. But you're talking, even if there was ever an investigation with a family, they would be caught up in that
That's correct.
file.
Yeah, in our enabling legislation, a CFSA child is defined as a child who is currently involved, previously involved, or has had any involvement with CFSA. So it's a CFSA child who also has a petition filed by the Office of the Attorney General in DC or in other jurisdictions.
Now, in your fiscal year 25 count, you say there are 19 dual jacketed youth. And this represents a significantly higher number than in previous reports. So was this because of a better reporting by your office or because there was just a significant increase in dual jacketed youth?
That's something that we will have to look more closely. But we did observe that increase in numbers. In the past years, it's been maybe 6 or 8 youth reported each year, and this year, yes, it's 19. So we will be working towards understanding that increase.
Okay. And I would just note that the district generally is seeing a decline in violent crime and prosecutions as a result, at a time where this data suggests that we're seeing an upward trend of prosecuted youth who have ever touched CFSA.
We partner with CFSA and DYRS to produce that report. So we, having a follow-up conversation with them as well, we can do that and share that information.
Okay. While not in the report, did OFC observe any notable trends or outcomes for dual jacketed and crossover youth when looking at the data?
So in regards to the crossover youth in particular, our work over the last year has been to create the infrastructure to report on the numbers that you've seen in our annual report. So that had required, I would say in fiscal year 2025, that required working with the individual agencies, identifying the fields in their system that we would need to do the cross-match. It included identifying the software, training staff to use the software. So there was a lot of technical work to be able to identify the number.
But in terms of trends, so let's take those 19 youth. What are we noticing about them?
Yeah.
Are they more male than female? Are they living in certain parts of the city? Did they drop out of school? Are there noticeable trends you're noticing across? Because what I want to get us away from is just reporting out on this data.
Yes.
And get us to a place where you're coming here to say, and this is what we think you should do about it.
Yes, and we agree with that approach, and that is our goal as well. Yes, that is our goal. In regards to the data that we have, 100% are Black or African American. The majority are male. And then the
Can
majority.
you give a count?
Um,
And is this just for 25 years?
This is just for fiscal year
Okay.
2025. So 13 male, 6 female, in regards to race, 19 Black or African American. In regards to location, the youth that are, the majority of youth are coming from Ward 7 or 8. There's 10, 5 and 7. And
Do you
5
have
and
a
8.
count?
5 in Ward 7, 5 in Ward 8.
5 and 7,
Mm-hmm.
and 5 and Ward 8.
Mhm.
What about the rest of the 9?
So let's see, 1 in Ward 1, 2 in Ward 3, 3 in Ward 4, 1 in Ward 5, 2 in Ward 6.
Okay.
And that's ward origin, specifically, and that's
So
specific.
that's not necessarily where they live. That's just where they were born or wherever the data exists.
That's right. Yeah,
Okay.
that ward or origin specifically for CFSA.
What other data do you have?
We
Trends, rather.
Mhm. The majority of youth appear to be residing in a secure facility or correctional facility. The majority had, in regards to school attendance, had truancy concerns.
Ah, ding, 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 ding.
Yeah.
I'm not surprised you said that. Do you have a count on that?
Yeah, and I'm not exactly, we'll have to get back on the difference between the numbers. So 11 were enrolled at some point during the fiscal year with truancy concerns. 1 had serious truancy concerns, which we'll need to define. And then the difference between 12 and the 19, the 7, we'll have to get back to you on that. We actually don't have that.
So at least
information
12 of the 19 had truancy concerns.
here. That's right.
Okay. What else? What other trends? This is helpful. What
Mhm.
other information?
I think it's also interesting that, so we have a count of 9, 10, 11, 12. So this is in regards to involvement with Department of Behavioral Health. So 6 were not enrolled in mental health services. 2 were no longer enrolled, but were previously enrolled. 1 was enrolled at the Hillcrest Center. 3 enrolled with MBI services.
So just making a connection to what I said earlier, I went to the DBH hearing
Mhm.
and that program, the Juvenile Behavioral Diversion Program, which is seeing success because they're providing targeted mental health services to young people in their care. And one of the trends you're identifying is that these young people who are dual jacketed are not receiving mental health services. Now, that's not causation, but it does make me wonder, is there something there that we can explore
Yep.
as a potential solution for what we're seeing play out in the city and with our
Yep.
young people?
Yep, yep.
I digress. Were there other data points that you want to look up?
I think those are the of the most critical of the data I have here.
I know in your annual report, and I did read the annual report, you make a lot of recommendations, namely to CFSA. A lot of those recommendations centered around training.
Yeah.
But do you anticipate, plan to envision making recommendations across government that may interact with CFSA involved youth?
Yes, absolutely. And we really try to focus on the broader, the bigger picture and not just the CFSA involvement, because we do understand that there may be a concern that comes to us, and the concern may identify CFSA as the agency that's not following the policy or the law. But as we investigate, We may learn that actually CFSA did everything they were supposed to do, but then there was a referral made to another agency who did not follow through in some way to providing services to this youth.
I'm thinking even more granular. Let's go to these crossover youth that you say.
Yeah.
You didn't mention grade level or age. Do you have age range for them?
I do. In regards to age, 3 are 15 years old, 2, 16, 7, 17, 3, 18, 3, 19, and 1, 20.
I'm sorry, how many are 19 and 20?
3 19-year-olds and 1 20-year-old.
All right, well, at least half of them, or actually the majority of them are school-age kids,
Yeah.
likely high schoolers,
Yeah.
although maybe they're caught up in that truancy group and not attending high school. But my point is, have you envisioned that maybe some of your recommendations might be to DCPS or to our charter LEAs to say, here's what we're finding with crossover youth, and this is what we suggest you do
Yeah.
beyond just the laser focus on CFSA
Yes.
as an agency
Yes.
in and of itself.
Absolutely. Because in our complaints, I think William looks like he might want to actually respond to this too. But in regards to the complaints we receive, they may start out with a focus on CFSA and concerns about CFSA's actions. But the more we dig into it, there are other concerns that we identify. Perhaps it's IEP related, that the services that are identified in the IEP
That's
are
right.
not being provided to
That's
the
right.
youth like they should be. So that is our goal going forward.
Okay.
Yes.
Can we make a commitment that this year that will be a focus? And
Yes.
so I guess the next annual report will include recommendations across government.
We
And
will
it
do
doesn't
that.
have to be exhaustive, but at least we're moving in a direction to think about all of the touch points or agencies that are touching young people in the care of CFSA. I'm thinking namely of our schools, but I can think also of DPR, for instance, perhaps, or there are other agencies. I won't rattle them off, but
Yes, we can make that
I think
commitment.
there's work across the board there.
Mhm.
What follow-up, if any, have you had from the auditor's reports on crossover youth?
Yes, so the Broken Web report names the Office of the Ombudsperson for Children in its recommendations. Trying to find that page, but I can say while I'm looking that part of the focus is around the sharing. It's focused on CFSA and DYRS providing us with the data needed to create our crossover youth reporting. We, of course, have been working very closely to do that based on our definition, to report on crossover youth based on our definition. So our next step is to work more closely with DYRS to add that data into our work. I think that will help us expand our understanding of these youth as we incorporate more data sources from different agencies. So DYRS is definitely on that list for us. Also, in regards to, there's a recommendation around, I think it's directed towards CFSA and DYRS, but I commented on it because it speaks to identifying metrics to inform, understanding about the crossover youth population. And my response has been, we actually have a list of metrics that we use to kind of guide our conversations with other agencies as we're wanting to build out our data and access information from other agencies. We have met with, for instance, we've met with OSSI. We've talked to them, and they have a lot of data, and we've talked to them about, kind of what it will take to share data across with our agency. And so we have some metrics that we've identified as important, one being the IEP piece. We think that's an important part. Graduation rates of crossover youth is another metric that we've identified. Employment outcomes is another.
And again, the push there, I don't want the Office of the Ombudsperson to just be a data office and you all are crunching numbers and pushing out reports. There is a value to that, no doubt. And so I guess my ask would just be, as you are doing that with every report, like what are the action steps, even beyond just training? Because as I looked at your end of year report, I would say 90% of the recommendations were training. But I feel like there are some more tangible action items that I'm going to be looking to you all's expertise to kind of guide us in the path forward. I want to be partners in this work, but let me keep moving for the sake of time. Zooming out, where do you think CFSA is today as it relates to its mission? Are they making progress? And if so, in what ways? Or is there more work needed? And if so, where?
I'm going to make some comments, and then if you make some observations as well. So I would say in regards to what the areas that are going well, I mean, in terms of advancing, technology and resources, the agency is doing well in that area. They've released the STAND database. We do understand that there are some data quality issues within STAND. There are some concerns about access to legacy information. So there's information still in FACES. And so we've asked the question, can the caseworkers actually get the data from FACES that they need? Like if there's documentation, court orders, that sort of thing, are they already attached to the case in STAND, for instance? I would say, of course, we talk a lot about the 211 warm line. We think that's going well. One area that we do want to look closely at in regards to the 211 warm line is we want to engage the collaboratives and the family success centers, because I think there's a lot of dependence on those agencies and organizations to actually provide the services that are the families are being referred to. So getting a better understanding of their work and how that's going is critical, I think, to us. We've talked about, one other area that affects our work, but I think it also affects how you work the case, is missing documentation in the case management system. So it's not, when we do our investigations, and William can talk more about this, but when we do our investigations, part of our review includes looking at court orders, looking at other documents that are associated with the case to have a better understanding of how that case was worked. Sometimes they're not there. The information's not there. Now, of course, we can get that information, and we typically do, but I also believe they have a policy to upload that information within a certain time frame, and we're finding that that's not always happening. Did you want to speak more to that? Or in other observations?
I agree. And so the documentation it gets entered, but it's not timely per CFSA's policy and procedures. That's what we're seeing.
And that's probably because social workers or managing teams aren't making sure that information is uploaded in a timely way.
Yeah. And I think we need to understand more.
And what is the impact of that? So fine, the report is not filed, but what's the consequence of that file not being in the system?
So as we're conducting our investigation in OFC, we can't tell what services and supports are being provided to the children and family at that point in time. So a lot of times the analyst just has to go back and keep checking the database to get more information as information and documentation is uploaded into the system.
Understood.
It's just not timely.
I would also add that it affects the agency itself as well, because if the workers and the supervisors don't have all the information in terms of what's occurring with that individual case, that could affect decision-making when it comes to the families.
That is clear. Okay, I'm going to move on for the sake of time. In your performance oversight hearing responses as part of your performance plan goals, you mentioned establishing a secondary child fatality review process with a focus on incidents that occurred while a CPS case was open. Why is this a goal?
So this is a goal because through our enabling legislation, we are required or expected to sit on various child fatality review committees. There's the infant mortality review team, there's the CFSRT, Child Fatality Review Committee. CFSA has the Internal Child Fatality Review Committee, which they are currently revamping. We talked about that. And so my thinking is that it's great to be on those committees and be a part of those discussions and identifying recommendations for improvement. I wanted to kind of focus us on the role of the ombudsperson or the team on those committees. And so what I did was, there's an ombuds office in another jurisdiction that all the child fatalities goes through this child and family, that particular child and family ombuds office. And so actually William and I were on that call with that ombuds to just learn more about how they use the data, what they actually do as an ombuds office that sets them apart.
And would this be a review that's internal only, or would you expect partners to also be a part of this review process?
You know, for now, it's internal. It's a secondary review in the event that perhaps there's something that is missed that we might see.
You have reason to believe that things are being missed in the other review processes?
We don't necessarily have a reason to believe that, but we want to know more when there's a CFSA, case open on that youth.
I got it. So I'm just connecting the dots. So you have 5 fatalities that you're reviewing, 2 that have been completed, 3 that you can't tell me the date that it will be completed, yet you have a goal to create an entire new fatality review process. And I understand if you're saying, oh, in our analysis, we are finding that they have missed X, Y, and Z, but it doesn't seem like you're able to tell me that. So I'm just kind of questioning why we are carving out this as a goal. And maybe it is worthwhile, but like, how do we know it's not just you saying, what are we going to do this month or this year? But it's actually in service of something that is needed in this space.
Yeah, and I fully understand that question. And my goal is definitely not to find additional work because we do have our hands full. But I do want to be thorough in our work and the expectations around the office and the impact that we can have.
Is it that you believe the fatality should be controlled by the ombudsperson's office?
I don't necessarily
Like
believe
that
that, not
other
at this point.
jurisdiction?
Not at this point. I suppose when we complete the other 3 reviews that we will have, I'll have a better sense of
Are
how
there
useful
any
this is.
concerns raised based on the 2 reviews you did complete?
Nothing significant, no.
Okay. What progress have you made towards this goal of creating a secondary review process?
We have a tool. We've identified cases. We started with 5. And, we've started reviewing those cases as an additional review.
Okay. And how does this process differ than CFSA's internal review process?
When their internal review process was occurring, it's essentially just a second look, quite frankly. They have, other resources that they use since it's an internal review committee. But it's a second look is what we're doing. So it's a little different.
Okay, but how?
Yes. That's,
Are you looking
That's a
at
fair question.
different data points? Are you, I'm trying to genuinely understand
yeah, I understand.
the reason
Yeah.
for this, like, the reason for this activity.
Yeah, I understand that. Yeah. Um, I would say that it is due to the thought that an additional, perhaps an additional eye on the case would identify issues that are not picked up in the original review, additional recommendations that can
Gotcha.
be implemented, and that we can, work with CFSA or other agencies to implement.
And again, I think that's worthwhile. I think that that's really sound, but I would hope then you could also back that up by saying, and we have found instances where here are things that seemed odd or peculiar.
Yeah, I
Or these
understand.
processes weren't followed, but you're not giving me that.
Yeah.
So anyway, I'm gonna keep going. In your annual report for fiscal year 25, you were able to successfully identify crossover youth. We talked about this a little bit. I'm clear on how the data was collected, but something that struck me, and do we have those numbers handy? Do you have the numbers handy?
I believe I do.
I was struck by
Find them.
I was struck by the numbers.
Mhm.
And for the periods identified in this table, for calendar year 2021, you have the crossover youth count at 368.
Mhm.
For 22, 485. For 23, 651. For 24, 670. Now, again, I think how you all are defining this is any young person that has ever touched CFSA, whether that's they're in the system or they even were part of an investigation. Are these unique cases or are these cumulative year to year?
These are unique cases for each calendar year. So, for example, calendar 2021,
Mhm.
let's say you have John Smith. John has a history with CFSA. A petition was filed in 2021 by the OAG for John. He would be in this count. That would make him a crossover youth. Let's say in 2022, there was no petition filed for John. There was just a petition filed in 2021, not in 2022. He is not counted in 2022 because a petition was not filed in 2022. But in 2023, let's say there were two petitions filed in 2023. We only count John one time, but he is counted in 2023.
Got it. So there are repeat youth in this count from year to year, perhaps.
There could be, and that's where I think more robust longitudinal data analytics could be used to understand across year involvement.
Okay. I'm gonna keep moving on, but I'm struck by those numbers. And when we have the OAG, I have a series of questions here for his office as well, just about like, one, can we be aligned so we're saying the same thing? But two, how do we track this information in a more intuitive way? Most importantly, I think for your office, what I'm looking for is, now what do we do about it?
Yeah.
And granted, that may not be fair to say, solve all of our juvenile delinquency problems, but I would love to thought partner with you around, like, what are the solutions for this?
Yeah, and we would love that as well. We understand that this is only really the very beginning of the reporting, and the real value comes from looking at the data and identifying trends or outcomes or recommendations, experiences, quite frankly, of the crossover youth beyond the numbers, but what are the experiences of these youth? And this does not get us there in this particular report, but that is the goal. That's the long-term
Understood.
goal.
Understood. Something I'm thinking about when I talk with the OAG is how do these numbers refer or relate to the overall paper rate for youth? Like, are we seeing the majority of youth are these crossover youth that have once touched CFSA, or is there something else going on? All right. In your performance oversight hearing response, you identify one of your goals for fiscal year 26 as wanting to establish an understanding of collaboratives, family success centers, and diversion. What does OFC seek to understand with this new focus on these issues?
So yes, and that's really connected to the 211 warm line and those agencies being the primary vehicles for providing services when individuals are in need of additional
Yeah,
assistance.
our collaboratives and family success centers gave very compelling testimony during the public oversight. One, about like the great work that they're doing, the support they feel like they're receiving from CFSA, but also how they just need more support and resources. So something I'm also interested in is how do we make their work more sustainable?
Yeah.
So that it's not just an endless hamster wheel of sorts of these programs that are serving as lifelines. People are seeking out their support week to week because they just basically don't have their basic needs met.
Yeah.
So I think that is worthwhile, and it would be I would be interested to go one step further to say, and the families or the young people connected to those families and care of the collaboratives or family success centers, what are the outcomes there? Are we seeing different or better outcomes? I think that would be a worthwhile perspective or investigation. Just my 2 cents there.
Yeah.
Can you please share more on the proposed legislative modification you have requested in response to question 21?
Yes. So kind of getting back to, if I'm remembering, the
You say OFC would like to explore change to the enabling legislation's language, changing the CFSA affiliate definition.
yes.
CFSA affiliate means a CFSA license or contracted service and placement provider or entity that must operate under or comply with guidance from CFSA.
Yes.
You want that changed to something more like community service provider, any community provider providing services to a CFSA child or family. This change would affect the following sections, blah, blah, blah.
Yeah.
And so what's the reason behind that?
Yeah. So, and it somewhat goes back to the part of our conversation today, looking more across in terms of being able to hold agencies accountable beyond just CFSA. So our understanding around CFSA affiliate, which I have, this definition here from the legislation, this limits us to agencies that must comply with the guidance from CFSA. Not every agency has to comply with DYRS doesn't have to comply with guidance from CFSA, quite frankly. So if we can broaden this definition, then that would give us more, I think, authority to look at those other agencies.
I got it. Okay, that is a helpful explanation. Can you speak generally to the recommendations that OFC has made to DRS based on the Broken Web report on crossover youth?
So we've had a conversation with DYRS to talk more about crossover youth. That conversation was focused on, working together to identify prevention strategies that would help crossover youth, keep them from crossing over, provide them with the kinds of services that they need, and certainly, ideally, keep them from being detained in one of the DYRS agencies,
And
facilities.
what are some of those strategies?
So those strategies would include, for instance, how do we work together to provide greater services, better services, identify services that would be of use or useful, helpful to the youth. That's I think a big one, quite frankly, to keep them out of YSC.
And to your knowledge, has DRS implemented any of your recommendations?
So we had a recent conversation. The kind of takeaway was that there's the Georgetown Crossover Youth Project that's occurring. So from the agency, there appeared to be a great desire to build that out, the Georgetown work out, and use that as the vehicle for addressing our recommendations and other needs of crossover youth or DYRS placed youth.
And have they made any progress with that Georgetown group?
So I would say that they're starting to work more intentionally, I would say, towards getting to addressing crossover youth. There's been a lot of focus on the definition in this last couple of weeks of what youth to include in a definition for crossover youth. That seems to be the piece that has to be locked down before the other subgroups can really move forward with the work. There's an information sharing work group that has been meeting. There is a case management group, and then there's a data group as well. So they are making progress, but it's very focused on the definition, I would say, and orienting all the different multidisciplinary teams to the work that they're attempting to do.
Okay. Where is CFSA with the recommendations that you've provided in your annual report?
You want to speak to that?
So we are waiting response for 3 of the recommendations that we made, 3 cases that we sent. And so we reached out last to CFSA in October. And so we're just awaiting a response for those 3. And then we have 3 for fiscal year 26 that we're going to send to CFSA as well.
Okay. Okay. You mentioned in your performance oversight responses that you want to purchase professional ombudsman association memberships for all OFC employees. What is the benefit of these memberships?
Well,
and how much do they cost?
so the ombuds work in itself is kind of a unique field, if you will. It's been around for a very, very long time. I mean, the history goes back significantly, but it's unique. Not everyone is fully knowledgeable of what ombuds do. And so the United States Ombudsman Association and specifically has a very large association, a very large membership in the Child and Family chapter. And it's an opportunity to learn from other offices as to how they conduct their ombuds work. So there are offices that are present in those meetings that have been around 15, 20 years, maybe even longer than that. And they've been doing this work for a very long time. So, as you know, we are relatively new. It hasn't even been 5 years yet. So it gives an opportunity to not only network and get to know people, but also just to understand how the pillars, how to implement those pillars of ombuds work to be an effective ombuds office. I will say that I work very closely with the Child and Family chapter of the United States Ombudsman Association. We have monthly meetings, and our goals are to provide opportunities to bring in people to talk about ombuds-related work, and then also have certain meetings where we just focus on sharing with each other how we do certain things. For instance, one month we focused on how do individual offices conduct investigations? Like what does, Massachusetts do that's different from California, quite frankly. So I think
And
it's very helpful.
how much is the membership?
It's $250 annually.
Got it. How many complaints led to an investigation so far in fiscal year 26?
You have that number?
15.
Oh, it's 15. 15,
So 15 investigations to date.
yes.
How many of them have been closed out in 45 days?
Of the 15,
Yep. Has there been 45 days?
Yeah.
Oh, yeah, there has. Fiscal year 20.
we can follow up with you on that.
Yes.
Yeah.
I was thinking of the calendar year.
I understand.
But fiscal year,
Sure.
there hasn't. So since you're using that as a benchmark, it will be helpful to know how many have closed out. You mentioned a potential barrier to scaling your office beyond adequate funding is gaining the support of child advocates. Do you fear you don't already have the support, or how can this committee help in gaining the support of child advocates?
I would say from the point of view of the child welfare, child advocates, we have a lot of support. Specifically, I was focusing on the advocates for those other areas. So I don't know the juvenile justice advocacy community, but I suspect that we probably would have to get their support. I have not been plugged into that area as well, at all. And then, I was thinking about the education sector also. I know that the public charter school, we've interacted with the public charter school boards, ombuds office, and I think it's DC Public Schools. They have an ombuds office as well. So, I think we'd have to think strategically about how that, because they have established ombuds office, how that transition would work, so.
Okay. I do want to get to our friends at CFSA, but let's talk about staffing really quickly. Where are you now? And there were some changes made in the budget, and what are your projections moving forward?
Sure. So currently, we have 4 employees. We have myself, the deputy CFSA ombudsperson, and we have 2 ombuds analysts. Due to changes in our budget for this particular fiscal year, we did not get the funding for the chief deputy role. So that is a role that I would like to advocate for in the future. I still stand behind having a data analyst on the team, because I agree with you, we should not necessarily be designed to just constantly producing reports and doing analytics, but I do think it helps with the oversight work, and to have someone that has that explicit experience will likely move us forward faster. So those are just 2 areas that I'm thinking of.
Okay. And what are so it's you and who? You said 2
Yep.
analysts?
Yep, we have 2 ombuds analysts. It's myself, William Thomas, or the deputy CFSA ombuds person role is funded.
Okay.
Yeah,
And then who's responsible for those investigations?
primarily in the,
Analysts.
yes, they support the deputy CFSA ombudsperson. So they're the primary, work piece around the investigations.
Okay. What are you most proud of over this last year in terms of your office's work?
Frankly, it is the crossover youth work, because it took a significant amount just to put the infrastructure and organizational pieces in place to even accept the data and to get to these numbers was a significant feat. So I would say that's, in terms of just pure doggedness, quite frankly, to get the information, that would
And do
probably
we
be the
have
most.
the outcomes for those youth? So I know you have the count, but how
Yeah.
many of
Yeah.
them were diverted and or adjudicated or
We do not have that information, but one thing that we are looking at is, because we have access to CFSA system, and I think we can get access to other systems, to create almost like a qualitative review of those youth, so that we have information about their experiences over time in more detail, like what brought them to care, what was the referral, what was their experience in care, how long were they in care, a lot more of
and
that.
is that data you can collect as you're getting the data from other agencies?
We can certainly create those narratives because we have access to Stand, quite frankly. It takes a little effort, but.
But even OAG should be able to tell you, here's how many crossover youth we have.
Mhm,
Here's how many of them ended up in detention versus not,
mhm,
for how long. I
Yeah.
just think, and this is not just on you, but across the board, we need more actionable data
yeah,
so that we can identify trends to come up with strategies and
Yep.
solutions to kind of deal with the
yeah,
problem.
I agree with that.
Okay. Is there anything we did not cover that you wish to cover?
No, I think we covered everything.
Okay,
for the-
knowing that we're approaching budget season and there has been a routine effort to eliminate this office, I'll give you the final word here. Why should the ombudsman for children exist?
Yeah, I think when you think beyond I think a couple of things. One, I would say we are a service to DC constituents who have concerns about whether CFSA is following their policy, procedures, the law, or best practice. And we can handle those concerns in a confidential manner, giving individuals a voice when they may feel like they don't have a voice and they're not being treated fairly. So, and so that's one thing that stands out for me. The other part I would say is we're really working towards a significant return on investment, quite frankly. So I would say, CFSA experienced a lawsuit. We're involved in a lawsuit for over 30 years, or I think it was over 30 years, about 30 years. I can answer that question. 32 years. Working closely with the agency as an internal monitor saves CFSA and the DC government potentially millions of dollars. Because if we're working with the agency, we're providing them with appropriate feedback on their casework, missing documents, whatever that could affect the services that they provide, could save them from a lawsuit, which is hugely expensive. I came from Tennessee. Tennessee was in a federal lawsuit for 17 years. And I got to observe from the front lines what it took to get out of that exit. And it's an expensive endeavor. We are not as expensive, quite frankly. And so as we work closely with the agency and other agencies in the district, I see us as being cost effective, as well as having a positive impact on children and families in the DC area locally.
Case well made. Well, thank you for your work. We will be sure to follow up. If you can share those follow-up items with the committee, we will appreciate it. Thank you
so much.
Thank you.
Appreciate you.
All right, we are moving along and we'll transition now to Acting Director Tanya Torres-Trice of the Child and Family Services Agency. All right. If you could raise your hand and affirm or attest that the testimony you're about to give is the truth, the whole truth, and nothing but the truth.
Yeah.
Awesome. Awesome. Feel like I'm on an airplane where they say you have to verbally say it. Director, I will say on the record, just for public awareness, what I shared with you earlier. It is the committee's full intention to support the confirmation of Acting Director Tanya Torres-Trice. In fact, we had a markup and that nomination moved forward unanimously. And we planned on filing that resolution on this Tuesday's committee of whole meeting, but because of a bunch of technicalities, we were not able to. We will therefore file it on the next committee of the whole legislative agenda, but that will fall after the timeline set for you becoming the official director. Even still, we're going to move it. We will speak to it, and the committee was proud to advance a recommendation to support your nomination. So I just want that on the record. And with that, you may give your testimony.
Thank you. Good morning, Chairperson Parker, members of the Committee on Youth Affairs, committee staff, and those here and tuning in back at CFSA and the community. I am Tanya Torres-Trice, proud social worker, Ward 5 resident, and acting director of DC's Child and Family Services Agency. Joining me today are key team members of my leadership team, Deputy Director Elizabeth Muffaletto, who leads the Office of Hotline and Investigations, where Child Protective Services is housed, Deputy Director Ann Riley, who oversees our in and out-of-home administrations, which includes all of our case-carrying social workers, and Deputy Director Nicole Gilbert, who leads our Office of Wellbeing, managing our on-site clinic, mental and behavioral health services, and older youth programs. Thank you for the opportunity to testify today on CFSA's performance in FY25 and FY26 to date. I'm sure we say this every year, but FY25 was not an easy year. But as an agency, we did rise to the challenge. CFSA has remained steadfast in its commitment to supporting the district's children and families and building a child and family well-being system. My testimony today will focus on our accomplishments, our current state, some of our challenges, and our priorities in this coming fiscal year. Some of our key accomplishments this year in 25 included, in February, we fully launched the 2-in-1 Warm Line, a district-wide resource line that supported close to 12,000 residents with various needs. In June, we launched STAND, Stronger Together Against Abuse and Neglect, as our modern child welfare information system, and it continues to evolve with user-driven enhancements. Recent improvements include AI-powered tools that streamline documentation, while we make steady progress on legacy data migration to ensure accuracy and reliability. STAND's embedded AI assistance, Cora, in partnership with Octo, earned a national recognition in Government Technology's AI 50 Award. Additional upgrades include improved assessment tools, better quality reporting, and an enhanced portal to support kinship and facility licensing, setting a new standard for child welfare case management technology. In November, we launched the Opportunities for Prevention and Transformation Initiative, or Opt-in partnership with the Doris Duke Foundation. This voluntary research-based pilot, led by the Office of Hotline and Investigation and the Office of Thriving Families, targets screened-out hotline reports involving children with families 1 to 3 when calls mention housing, clothing, or food needs. In its first 30 days, 22 families were supported with tangible assistance. Built on a clear theory of change, Opt-in aims to engage families earlier and reduce future involvement in formal child welfare systems. In December of 2025, CFSA expanded its contract with the Foster and Adoptive Parent Advocacy Center, or FAPAC, to further strengthen our recruitment and retention efforts through this partnership. FAPAC will support the recruitment and retention of DC-based resource parents in collaboration with CFSA. This initiative includes ongoing oversight and management to grow the pool of resource parents, ensuring children receive the individualized care, stability, and support they need to thrive. It also involves modernizing CFSA's social media outreach, maintaining connections with prospective resource parents from initial interest through licensure, and providing a dedicated point of contact which happens to be an individual with lived experience, a former foster and adoptive parent, to answer questions and offer guidance along the way. Our current state, as of December 31st, 2025, CFSA is serving 544 children in foster care and an additional 799 children in our in-home care. Of those in foster care, 33% were age 0 to 5, 25% were age 6 through 12, 26% are ages 13 to 17, and 16% are ages 18 to 20. 80% were Black or African American, 12% were Hispanic, and 2% white. Nearly half live in Ward 7 and 8. One trend that continues this fiscal year is that families coming to our attention continue to face increasingly complex needs. To address these challenges, CFSA continues to partner with sister agencies and community organizations while taking stock of our current workforce and pivoting to meet the complex needs of the children and families we serve. Placement array. Placement array will continue to remain a priority for CFSA. Recognizing the importance of familiar, supportive environments, we continue to work to strengthen our placement array. CFSA prioritizes kinship placements to keep children connected to families and maintain sibling bonds whenever possible, and also emphasizes foster homes, recognizing that family-based environments provide the strongest foundation for a child's well-being. For youth with complex needs, such as autism, behavioral challenges, or significant mental health concerns, we do rely on specialized placements and highly trained resource parents. Each child's situation is unique, and our placement strategies reflect that individuality. CFSA maintains contracts with providers like the National Center for Children and Families, or NCCF, which served nearly 44% of our youth in care last year. In August of 2025, we added an additional 25 beds to the contract to meet the increasing demands of foster and kinship placement. Our placement array also includes specialized group homes, traditional, therapeutic, pregnant parenting teen options, and homes for youth with developmental delays. The Pathways contract was executed in November of 2025, which replaced Life Deeds and now serves as a bridge while we work to identify the best long-term placement options. Overnight stays in our building and placement instability remain the most significant challenges. These situations highlight our urgency of expanding and diversifying our placement array to ensure children experience stability in care without unnecessary delays. CFSA is committed to reducing these occurrences by strengthening our partnerships, recruiting specialized resource parents, and increasing placement options tailored to individual needs. Workforce strategies and retention. To address the staffing need in crisis areas, CFSA is advancing recruitment and retention efforts in-home and out-of-home care, clinical case management, and hotline and investigations. We've launched targeted advertising on DC's Department of Human Resources career sites, conduct daily applicant screenings, weekly interviews, and make timely offers to a 3-member panel to ensure alignment with program needs. To strengthen the pipeline, we are engaging local social work programs, attending quarterly job fairs, and leveraging the new licensure pathway with the DC Department of Health and the Board of Social Work that allows for Masters of Social Work graduates to obtain a licensed graduate social work licensure using their education credentials. Internal promotional opportunities are also available for current employees with MSW degrees who want to transition into social work roles. To support the recruitment efforts, CFSA implemented a $5,000 hiring bonus for social workers in critical areas. To date, 19 social workers have taken advantage of this incentive. These efforts, combined with proactive vacancy management and ongoing partnerships, aim to reduce attrition and maintain continuity of care for families. Recognizing that organizational culture and workplace safety are essential to retaining highly qualified, well-educated staff, CFSA has partnered with the National Partnership for Child Safety and will work to identify areas for improvement, beginning with an evaluation of our current culture and safety practices. This process will culminate into the development and implementation of strategies designed for and with Team CFSA and will remain a focus in the coming year. As CFSA continues in FY26, our commitment to building a child and family well-being system that prioritizes prevention, equity, and collaboration remains strong. We will continue to create a system where every child is safe, every child and family feel supported, and every voice, especially those with lived experience, is valued in shaping our solutions. While we continue to monitor and advance other critical metrics, I have identified 4 agency-wide priorities that will serve as a foundation for meaningful progress. These priorities reflect our strategic focus on safety, stability, and innovation, ensuring that children remain connected to their communities and families receive the support they need to thrive. In 26, the 4 key priorities are: we will continue to focus on safety for children at all levels of agency involvement. We will continue to enhance our resource parent pipeline. We will continue to strengthen our focus on kinship, and we will continue to implement enhancements to our case management system. These targeted priorities will help children safely connect to their communities, support family stability, and enhance long-term outcomes. In conclusion, we are proud to stand alongside Mayor Muriel Bowser, whose leadership continues to set a national standard for child safety and family well-being. It is an honor to serve on behalf of the district's most vulnerable children and families. Every member of CFSA brings passion and purpose to this mission, collaborating relentlessly, no matter the obstacle, to find solutions that strengthen outcomes and create lasting change. I want to thank our community partners, whose collaboration is also vital to the support we provide to families. Your partnership strengthens our ability to deliver care, stability, and hope, and we deeply value the role you play in helping us achieve the mission. I want to especially express my gratitude to Team CFSA for your dedication and tireless commitment to the children and families of the district. Your work is not just a job, it's a calling that ensures safe, healthy children and strong families remain the cornerstone of our community. These are the resources our cities need and deserve, and your efforts make that possible every single day. Until every child is safe and every family has the resources not only to survive but to thrive, our work remains essential, and we will never stop striving for improvements. Together, we are building a system that reflects a compassion and resilience. No problem. Finally, I'm almost there, I promise. I extend my sincere thanks to you, Chairman Parker, and your committee for your leadership and support. CFSA remains committed to operating with transparency and accountability, and I will ensure that communication with your staff continues to be open, productive, and solution-focused. This concludes my testimony. I'd be happy to answer any questions you may have for the team and I.
Awesome. Thank you for your testimony. Like we did with OFC, I will start with public witness testimony and then get to pre-planned questions.
Okay.
On January 28th in our public oversight hearing, we heard complaints that the website for CFSA policy is outdated, where it shows the eligibility for the grandparent and close relative caregiver program is listed as 200% of the federal poverty line when eligibility is actually 300%. When was the website last updated?
The website was last updated over a year ago, and they are correct. That is outdated. I did go back and check. We are working to update the website by the end of Q2, pending the vote of the CRCP, GRCP bills that are going through the process now, because it is expensive to update websites, and we want to go in and do one update at a time. But they are correct. It is outdated.
Okay, so by the end of Q2.
Yes.
Which would be the end of next month.
March 31st.
Yep. Okay. Why are CFSA documentation requirements for TANF different than those of DHS for relative caregivers applying for TANF as part of the grandparent and close relative program? Of note, I believe I took notes where one participant was saying for DHS, you can use a lease, but for CFSA, that is not an eligible document.
That is inaccurate information. It is eligible documentation. In fact, I sat down with the team after public witnesses just to go through the site myself again to understand what the resident would see when they were applying. And there are set documents that are required, but if they don't and don't have them, we will try to work to get any type of documentation to get you eligible for the program. If you're a DC resident, if you have care of the child, and you can establish that relationship.
And so am I hearing you to say the requirements are the same as DHS?
I don't know the DHS requirements, but I am saying that we are very flexible on our requirements. And while we have listed on our website license, lease, you have to have a youth enrolled in school because we value education. If you don't have those things, we do work to figure out what you do have. We have seen copies of somebody paying a water bill at a residence be a proof of residency or that they are living somewhere. So we are, I would venture to say, flexible in our documentation requirements. I don't know exactly what TANFs are, but I did see the application and it's far lengthier than ours. And so again, I walked through every step of the process with the team after public testimony.
And we have heard from caregivers and advocates that they have trouble tracking the status of their applications once they have submitted. Can STAN be updated so that applications can be tracked by caregivers after they submit them? So essentially, it's like documents go into a black hole and they're not sure what the status is or even if they've been received.
Yeah. Again, I walked through the process. So when you do submit your application, I've made a dummy account. I became a user. When you submit your application, you first get an automated response that says your application is under review. It gives a general email box to the Kin Navigator program, just general. And it is our responsibility to review within 24 hours or the next business day, at which time they're assigned an actual person. When that does happen, it moves from the general box to the supervisor and then to the resource development specialist or the Kin Navigator. They get a second email to their email address that says your Kin Navigator is so-and-so, John Smith. John Smith's number and email address are right here for you. And if you have any questions, reach out. But John Smith would also be responsible for reaching out to that applicant that same day to ensure that, number one, their application is complete. If they were missing any documentation, to talk them through that. Now, it is true that all applicants have to have an email address. If they don't, we will also go to them in the community. We will help them create an email address. We are not trying to create barriers for our grandparents and caregivers to enter into this program. And I did hear that feedback, and so I did want to assure with the team that we are reaching out within the time frame, and they did confirm we are reaching out, and they do have an automated response and person to contact, but it is also our responsibility to reach out within 24 hours.
And the email is required because that is the way you all are primarily communicating.
That is correct, and that is how they upload their documents. And again, we have heard, and the team did say, that some of our grandparents do have trouble sometimes navigating, uploading documents. We'll help them with that. They can come to the office or we'll go to wherever they are.
Is it possible for the applicant to receive a copy of their application?
It is possible. They receive at the end of the process when all information is complete, they do receive a copy of the program requirements, and it is a signed copy that they sign, and they do receive a copy of
And they, via email, they receive a copy of that?
And I'd be happy to share what one of those looks like with you.
Okay. Regarding case management, what remedies currently exist for families who are placed on the Child Protection Register?
Sorry, Councilmember, can you go a little deeper in that? I'm not sure exactly what you're asking.
We heard testimony about families ending up on this Child Protection Register and them not being clear what remedies exist. We're also aware that parents have a right to an administrative hearing to have their name removed. But what are the outcomes of these hearings? Are parents successfully having their names removed, or are they allowed legal counsel present? It's not clear what the outcomes are.
Sure. So all families have the right to a fair hearing should they not agree with the decision CFSA made. Some of them do result in their names being removed, some do not, but they do have the right to contest the decisions made by CFSA.
And how does one end up on the Child Protection Register?
If they are found, they're writing me a note. If they are found to have abuse or neglect of a child.
And that would mean what? Then they can't be in the presence of that child?
That is correct.
No.
They can't.
Maybe.
She's saying no. Go ahead.
So when somebody is substantiated for abuse and neglect in the District of Columbia, their name is put on a child protection register. And that could prohibit them from employment, volunteering at a child's school, just certain safety sensitive positions.
But does it preclude them from being around that child?
No, it doesn't. Mm-mm.
Okay.
And so we do let legislation was previously passed regarding automated expungements. We have a tiered process. Previously, in DC, once you were substantiated and placed on the register, you were on for life. And we petitioned, and now there's a tiered process for 1, 3, and 5-year expungements. There is another process that Director Torres was referring to regarding our fair hearing, and the other process that you were referring to is our program administrator review.
Can you say more about the tiered expungement?
Yes, I'm happy to provide information to help to you after.
What is that like based on severity of the allegation?
Yep, so it's based on the type of allegation, the severity, if the child ended up being separated or was court involved. So it's a tiered process that, again, I'm happy
And the
to
max
provide.
penalty is for 5 years.
Yes, however, that can be extended if the parent were to be found substantiated again during that 5-year process. And there are certain offenses that are not expungible. That would be the death of a child, any sex abuse allegation, or any allegation that falls under the definition of serious physical injury.
And even though that's expunged, would you all have records of that internally?
Yes.
So let's say a substantiated accusation of abuse against this person is now 7 years later, it's been expunged. You all internally would still be able to flag this person to say they've had this record. Therefore, perhaps they should not be a foster parent.
So for our records, our internal records, we are able to keep their investigation and that substantiation in our STAN system. As far as a child protection register check for employment, they would not show up. It would show that their record was expunged based on the law.
For an employment check.
For employment.
For someone trying to work at CFSA.
Correct.
But I guess what I'm getting at is for a family that wants to adopt and or be a foster parent, would this registry pop up internally for you all?
So
Even after the expungement?
So their agency history would,
Yeah.
but on the register, they could be expunged depending on the allegation. But our agency history remains intact
Okay.
in our systems.
So if we looked at the Child Protective Registry, they may not come up. We do research on our history, they would come up in our legacy
Would that
system.
preclude someone from being a foster parent if they were accused of abuse 10 years ago?
It could. It could. There are home studies done for all of our resource parents or adoptive parents, so it could.
Okay, more to come there. Are parents notified about their case closures when they are closed? If so, how? We heard repeated testimony, and now this is like the 4th time we've heard this, where moms in particular are saying, I was under a high level of stress, which I can imagine if you're being investigated by CFSA, you all look pretty tough and your job is pretty tough. And they're saying, we don't know when it's over. So how?
This is why I brought Deputy Muffaletto to talk process.
Okay.
So in all of our best practice is to send a notice of investigation findings to each family that is investigated. I will say from a practice perspective, it is our policy to do so at the end of each investigation. However, I know that sometimes folks don't always do that. And so that is an area of focus for my team, is to ensure that that communication is held. We recently actually just had communication with the Office for Families and Children regarding a family who didn't get notified, and we ensured within 24 hours of knowing that we sent that notice of investigative results to the family. So that is something that I've asked my administrators and my program managers to tighten up on practice, to make sure that we are communicating through the life of the investigation, and that families know when it is closed out. It's more often than not, I think that it's when we unfound or we don't find that there's abuse or neglect that the investigation is closed, and perhaps that's not communicated to the family. If a family is substantiated, most likely we're opening an agency case, so that has to be communicated and a joint home visit is conducted. So from my personal perspective, I believe it's those referrals that are closed out without a finding, and that perhaps the investigator.
Dropping the ball.
Correct. Correct. So
How do
something.
we make that more electronic? And
So-
what I'm thinking is there like a portal code that they can go in and see what is the status of my case? And so, yes, your team should still be notifying them, but they can also be empowered to go find out information.
I don't believe we have that capacity in stand, because families don't have access to our stand. We have over the years, we now send it electronically. We do have someone in our office that sends the letters electronically through email, or through text message. In previous years, prior to COVID, it was all snail mail, and we get a lot returned back to us as like that they no longer live there, it's the wrong address. So we have been trying to improve practice by doing it electronically, so we have a record and we can keep a record of that. But as far as an automated system, I'm not aware of that being possible at this time, but something we can look for
Okay.
in the future.
But best practice is that they should receive a letter within
Yep.
24 hours of.
No, not within 24 hours. I believe the policy is within 10 days of the investigation closing.
And they should receive that electronically and communication from their
Social worker.
social
Mhm.
worker.
Yep.
Got it.
Yep. And there's something else I was gonna say. Comes
We
to
make
me.
sure that they are, I think you
Yeah,
hit it.
we do document it in our system, when, that is, what I was gonna say is we also ask how the family prefers to receive it. If they would like it electronically and in the mail, we'll also do that as well.
Okay. And what percentage of CPS investigations are deemed unfounded?
I don't have that.
Please hold. Let
The
me
director will.
flip to that section. Do it this way. I don't know that I have it percentage wise, but I do have it number wise.
Do you want just for?
Can you repeat your question, please? Want to be sure I'm answering with the right. data.
Yep. I'm trying to remember my place. The percentage of CPS investigations that are deemed unfounded.
Okay.
And while you all look for that,
Mhm.
I wanted to go back to the register. So there's this tiered system, 1, 3, and 5. I get that. What is let me ask it more clearly. What causes you to be on the register? Is it that the finding was substantiated
Or inconclusive.
or inconclusive?
And inconclusive.
So I could be innocent, and because the investigation was inconclusive, my name still goes on this register.
So the inconclusive findings go on for a year, they're expunged within the year. The petitioner also has the ability to start the fair hearing process. So if I'm the subject of an investigation and I don't agree with the finding, it's a tiered process as well. You would put in your request to have a fair hearing. At that time, the agency would arrange for you to have what's called an informal PAR. It's a program administrator review. So it's someone from my team, a program manager or administrator that reviews the investigation, invites the family or the petitioner to CFSA or virtually, and has a conversation with them about why they feel that the finding wasn't correct. What new information is maybe brought to light since the investigation
But
had.
I'm still intrigued by inconclusive. What would lead a case to be decided inconclusive?
So an inconclusive case would be any investigation in which it was determined that abuse or neglect did occur. However, there's a lack of evidence to support who did it or how that child was abused or neglected. So
So maybe there's evidence that abuse happened
Mhm.
of the young person, but we don't have full evidence that we can prove it was the parent friend.
correct. I can give you a primary example. Our cases of unexplained injuries in infants, where they can't tell us what happened, and grandma, dad, mom, and auntie all cared for that child within 24 hours of that child being injured. So
Would they all be listed on the register in that
so
instance?
it kind of depends on what the investigation finds. We utilize our medical legal, our documents that we receive it throughout the investigation, as well as our work with MPD to try and narrow down who the possible suspect might be.
And is legal counsel allowed during this process?
Yeah,
For the accused?
yes, yes.
Okay. And then for substantiated, that means that you have found them guilty of whatever they're being accused of.
Correct.
Got it. I'm a little taken aback by the inconclusive, and one's name might still end up on that list for a period of time. I totally get the example you're giving. But maybe I'm innocent and now my life is upended for a period of time because I can't get a job because I'm on this register.
Yep, and it's my understanding that the inconclusive, it does remain on for a year. And I'm looking at our general counsel, but it does not impact employment. But it does, it will hit on our register as an inconclusive finding.
It does not impact employment,
And
meaning
only a
it
substantiated finding.
doesn't come up in background checks.
Correct.
Got it. Got it. So inconclusive is more so internal to CFSA.
Correct.
Understood.
I did find that data for
Okay,
you.
awesome. Again, the question was, what percentage of CPS investigations are deemed unfounded?
72%,
Are unfounded?
yes.
That's incredibly high.
Yes.
Can you say more? Yeah, I'm shocked that the number is that high.
Sure. So I have a breakdown here of the calls. So for example, in fiscal year 2024, we received 30,882 calls.
I'm sorry, give me that number one more time.
Sure, 30,882
Yep.
calls. And we break down, it's on question 39, we do break down the types of allegations made into our hotline. And so many times these calls don't result in an investigation. For example, we had 15,993 calls that had no allegation. Maybe they're calling for social service support. Maybe they're calling for
So
something
now
other
we're
than to
getting
report
to it.
abuse
So
and
that
neglect.
number actually includes those calls that are screened out
Yes.
as well.
Yes.
So how many of the actual investigations are deemed unfounded
Okay, I have that as well.
once the investigation has actually been launched?
So D of number 40, I believe. Let me make sure this is the right fiscal year 2024. Total investigation calls resulting in a hotline were 4,084.
4,084?
Yes.
Okay.
And fiscal year 25, 3,799 resulted in an investigation. And in the first quarter of 26, 1,014.
And do we know how many of them were deemed unfounded?
I don't have that breakdown here with this, and this is part of our STAN data migration that we are still working through. So what I do have ready today and submitted is the allegation types, but we haven't yet been able to break down the data that way.
Okay. I think that's important. If you all can follow up with that.
Yes, of course.
I'm looking at it. And I'm just looking here, for instance, their category sex trafficking, sexual abuse. My hope would be, and these are all things you're investigating.
Correct. That is correct.
I just would, I'm hoping it's not as high as 72%. So hopefully the investigation is rendering that most people are making referrals and you all are investigating worthy cases that are leading to an outcome positive for that young person.
May I correct something that I said previous? It is 7 calendar days and not 10 calendar days.
7 calendar
Yep,
days.
and I also just wanted to let the record reflect, we don't usually use the word guilty, that CFSA finds somebody guilty. It's that we found sufficient evidence that maltreatment has or has not occurred. I feel like using the term guilty is more in the criminal
Understood.
aspect. And so,
So just repeating, on the register, there are different tiers. You could be on that register for 1, 3, or 5 years based on severity. Best practice is that, I'm sorry, I'm conflating two different things. For the register, if you are deemed inconclusive or the results are inconclusive, that is more internal to CFSA.
Correct.
Only substantiated cases are public and would come up in a background check.
yes,
And then for notification of case closures where there is
investigation.
an investigation launched, the best practice is that the family should receive written notice within 7 days of the closure. And that notification should be given electronically and via that social worker to that family.
Yes, and I just wanted to add, there is the third tier, you stay on indefinitely. So I had spoken before about there's certain allegations, if you're substantiated for sexual abuse, death of a child, or if the abuse falls under serious bodily physical or serious physical injury, those constituents stay on the register indefinitely.
Indefinitely.
Because of the severity of the abuse.
Got it. There are a number of questions for older youth aging out. I'm gonna come back to that for the sake of time. We have a lot of questions for you all.
We're happy to answer all of them.
All right, let's jump here. How many pregnant or expecting youth were in foster care in fiscal year 25?
I'm going to have to look for, I didn't.
While
get
you
that
all are
one.
looking for that, there are subsequent questions that came up in terms of the support, care, childcare subsidies that they received.
Are pregnant and parenting youth, you're saying?
Related to that, I'm just throwing out questions. All of this is similar. Yes.
Okay.
Does CFSA track and support young men in foster care who are parents or who have partners that are pregnant? So both, how many pregnant expecting parenting youth were in foster care in fiscal year 25? And do you track young men in foster care who are parents or who are partners with someone who is pregnant?
Sure. So answer the latter part of your question. We do support young men who are fathers or who do have children. Now, we don't have any settings or group home settings where young men live with their children. Typically, the pregnant and parenting teams they're young ladies and they remain in their care. And we are looking for the answer of pregnant youth currently in our care in
And
fiscal year
while you
25.
look for that, is there currently a wait list for beds and independent living programs for youth who are pregnant?
Yes, there is. It's full. Actually, all of our group homes remain full and at capacity. And I don't know that I would say there's a wait list as much as I would say we are working to identify the best placement for the youth who either are expecting a child, because some of them do have other needs, behavioral and mental health needs, and we want to be sure that we're providing them the right support.
Okay. I'm going to come back to that question just for the sake of time, but if you all could keep digging for it.
Okay.
And again, the question was how many pregnant or expecting youth were in foster care in fiscal year 25? What mental and behavioral health counseling, referral, or outreach services does CFSA provide youth aging out of foster care?
Sure. So at CFSA, we do have Nicole Gilbert here as the deputy over our Office of Wellbeing, where we do have therapists on site. We do have substance abuse, mental health therapists on site. So they are able to access those services. We also work with our sister agencies to connect them to core service agencies through DBH at times if that is needed. As part of our youth transition planning process, It begins at 16, and we do hit the independent living skills and goals for our young people, and one of them is the behavioral health or mental health needs if they do arise for the young people aging out of foster care.
Okay. Multitasking, sorry. I'm bouncing around, but I'm going to switch gears. I want to go to the supports for grandparent and close relative caregivers.
Okay.
What is the grandparent and close relative caregiver daily subsidy rate for children under 12?
I believe it is $14.72. It ranges between $14.72 and $27.92.
$14.72 and 20.
$27.92.
And what is the rate for children 12 and older?
So that range is for all children. It's the number of children in the home.
So it's
That
not
would count.
It's not based on age?
It is not based on, it is for the number of children. We base it on the number of children in the home.
So you base the subsidy rate on the number of children. So if there is one child, I'm assuming that's $14.72.
Yes.
Okay. And what is it if it's two children?
I will have to find my rates. Please hold. Did all this tagging, I can't find it. Here it is. I did not bring the rate table with me, so I do apologize, and I will have to get that back to you.
Okay. So if you could just give a breakdown per child between the range of $14.72 and $27.92.
Mhm.
Are the rates published anywhere?
They are not.
And what's the reason for that?
I don't know that there is a reason. I think that we have had a lot of feedback from stakeholders that we haven't been as transparent with this data. We are in the process or the last year of updating our system and haven't updated many things, including this rate. I don't think it is an effort to try to hide the rate.
Can you commit to listing it on your website
Yes, once we update our website, we can commit to listing
by
rate.
the end of quarter 2? Which would
Yes,
be
that is the goal.
Okay, I love it. Clear commitment. So, and it would say one child, two children, three children, so on and so forth.
Yes.
Until you max out.
Yes. Now, of course, there are income requirements. If you meet the requirements, yes, we
Of
can
course,
commit
of
to,
course.
yes.
But that's just basic criteria.
Yes, that is correct. Basic
And
requirements.
the reason why this matters is because we've heard feedback, as I'm sure you have, that it seems as though family to family, the rate changes and there's just a lack of transparency and clarity. So glad that you will commit there. In response to question 120,
Mhm.
which asks, please provide the raw data that CFSA uses to calculate projected budget needs, considering proposed changes to the grandparent and close relative caregiver program rates and the age of eligibility. Also, please state the source of the raw data and provide the actual calculations made using the raw data. And you responded with, this request asks for information that is protected from disclosure by the deliberative process and executive privileges. Can you expound there?
Sure. So we
And
do,
my guess is someone in the executive wrote that for you.
it is
Because we
an,
had a whole legislative meeting yesterday where we talked about the deliberative process.
yes.
Which is important to note that the courts rejected that premise
Mhm.
from the executive. But I'm sorry, can you elaborate?
Sure. So our calculations have not been made public, as I just shared, but we do look at, oh, look at this. They just gave me the rate table. We do look at those aging in and out of care, the current budget that the grandparent and close relative caregiver have or give, or we are approved for. And it is true that we have not raised our rate since inception of this program. And our not trying to keep any information from anyone, but I do stand behind this response. And we aren't able to discuss all of the details of this calculation.
Can you please provide the raw data to the committee? So just to be clear, the committee is not seeking pre-decisional or deliberative information regarding how or why CFSA chose to use the data or calculations, more so looking at the final determination.
I will consult with GC and will respond to that at a later time if that's okay.
Yes. But we're not buying it. I think it's important to note, with respectfully.
Understood.
Respectfully. In response to your answer to question 114, where we say, please clarify, I'm sorry. You say new participants effective October 1, 2024 would not have their grandparent, caregiver, or close relative subsidy payments offset by the amount of TANF they receive. And I guess the question, does this apply to new applicants only or to new recertifications as well?
So at this time, it will apply to no one. We did make the decision as, again, we were transitioning to stand and building into that system rates. The legislation came forward to raise it to $38 a day. So we halted TANF offset altogether and have not implemented it anywhere. We don't have any plans at this time to do so until we hear and understand where the legislation falls.
So there's no TANF offset for anyone?
Not at this time, no, there is not.
What was the intention before? Was it for new applicants or for recertifications as well?
The intention was for both.
For both?
Yes.
Okay.
And I do want to correct, I did misstate the lower rate. It is $15.79. I found it on question 114.
Okay. So as in other words, you're waiting to see the outcome of the legislation we introduced.
Yes, because it will dictate what we build into stand and how we release the rates. So every provider who comes into the program becomes they get a W-2, like we have to account for and make them a user in
Yeah.
the system.
If there is a world where this budget process, we're not able to fund that legislation, it very well might pass, but we can't fund it. Will you move forward with what you have previously planned?
Yes, we will.
Okay. In question 68A, CFSA reports 0 near fatalities in 2025.
That is correct. 68A.
And states that make serious efforts to report near fatalities, like Washington State, find many more near fatalities than actual fatalities. Can you describe your process for identifying near fatalities and any efforts you are making to improve the detection of these events? In other words, people find the number 0 to be off. Like people are shocked that it's that low.
Sure. So I'm going to turn to Libby to define near fatality.
Yep.
Excuse me, Deputy Mapoletto.
I know we're currently actually reviewing our critical incident process to better define near fatality. And I don't want to misquote, but I can, in layman's terms, that a child has received a serious bodily injury that could possibly lead to death. And that usually comes from a call from a hospital saying that we have a child that's injured.
And who makes that call that it's a near fatal injury?
The hotline staff that would screen in the referral. And I can get you the specific definition that's used in our
Please.
structured
If you
decision
could
making.
follow up with that, that would be helpful.
No problem.
So the hotline staff are getting a call. Are they making that determination at the conclusion of an investigation that it was a near fatality, or?
No, so that allegation would be coded at the beginning of an investigation when a call is made to our hotline.
that I see a child and they look like they are suffering X
So
injuries.
the person who's calling in the report would provide us the information for us to determine whether that would be coded as a near fatality. And it would be based on the description of the injuries.
And I'm going to get to this, but you all are screening out the vast majority of referrals to the hotlines.
that don't meet the requirements for a child welfare response. A near fatality would most definitely meet.
That was good.
Yes.
That's good. That was good. That was good. But in all seriousness, you're screening out the vast majority. So a question to me is, are you missing some of these near fatality counts because of the 70+% of referrals that you're screening out?
Again, I'm gonna say that if we receive an allegation that a child has serious bodily injury, that is not something that we are gonna screen out.
Okay. I'm going to come back to that.
And I do have the outcome. No, okay,
We
sorry.
do have the data, but I would like to validate it
Oh, okay.
for the screened out substantiated and inconclusive allegations that you
Oh,
previously
you
asked.
going back?
Yes, sir. Sorry. That's my little.
I'm sorry, that was the number for what?
For the hotline calls that were unfounded and unsubstantiated, I just want
Yes.
to
Yeah.
be sure, again, we have investigation, we have data migration issues that we are working through, and I don't want to.
Understood. When does CFSA plan to post their fiscal year 25 grandparent and relative caregiver program reports online? And where will it be posted?
Okay, there is a section on reports here. Let me go find it. I do believe that report is due February 28th. And I did and have reviewed it and pushed it to the next level of review. Now, I don't know the date unless Nicola, you can tell me when it's due to be posted.
So can you follow up with a concrete date?
Yes.
And do you know where it will be posted?
On our public facing website.
On your website?
Mhm.
Is there a specific section of the website?
Yeah, our public facing dashboard, which also we are working to update with the changes of stand. I do want to call out that that is something we are very keenly aware of, and some of the feedback we heard from the residents and the stakeholders did speak to that.
Are the various foster care subsidy rates posted on your website?
They are not posted on our website.
And what's the reason for that?
I don't know that there's any one reason. When people do reach out and ask for the foster care rates, we do provide them.
Can you commit to also including those when you provide the other rates by the end of the quarter?
Yes.
Awesome. I love it. I love it. More commitments. We're on a roll. In your testimony today, you mentioned an enhanced portal to support kinship licensing. While the committee appreciates the intention to streamline these mechanisms, there are some concerns and complaints we've heard about their ability to access information using the portal. Any response to complaints that people can't really access the portal?
Not at all our goal. We want them to be able to access it. We want them to be able to use the portal. So we do take that feedback seriously. And when it is elevated, we do work to resolve the issues that they are bringing forward.
What is CFSA's current percentage of kinship placement?
21%.
The national average I have here is 38%.
That is correct. 35 to 38% is the national
35.
average.
And what's the reason for the gap there between the district and the national average?
Sure. It is, again, one of our key focuses this year in FY26, but many things attribute to the gap. First, if you don't move to kinship within the first 60 days, you're not going to be counted into this count. So we do oftentimes find kin later on in the case history, and their first move is into a foster home, but then a family member or a kin comes forward and we're able to move them into the home. So we have a high, keen focus on our kinship placements because, as I shared, We also are really struggling with our resource homes and traditional foster parents. But we have had this gap with the national average for some time. And I don't know if Deputy Riley wants to add anything to that.
I think one thing unique about DC is how many kin are living in Maryland, just right across Southern Avenue. And we are not able to license them as we could in DC. As the city has gentrified, many of our families have been pushed out. And so we are working with the state of Maryland and some nonprofit partners to talk about how we can license differently in the state of Maryland. Maryland passed different kinship regulations last year for Maryland kids in foster care. That does not apply to DC kids in foster care who need a Maryland placement. But we are going to work with their team to see if we can change that and get access to those regulations would allow us to place with more kin who are living in the state of Maryland.
Can you keep us updated as you work?
Absolutely. Yep.
What program or policy changes has the agency implemented that has increased the percentage of foster children placed with kin?
So I would say program changes is it's an initiative. So while we have many key metrics we are looking at this fiscal year, it is all of our responsibility. We have talked about it. We have engaged with national partners through Deputy Director Ann Riley's leadership in trying to understand our current practices, but also what we can do to improve our kinship work. And some of that we are finding is in DC, it is expensive to live, and our families aren't able to take in their children. But if there are ways of looking at it a little differently or structuring our budget to meet the needs of the kin, we are open to all of that. So in addition to working with our Maryland partners, we are working with national partners to address our gaps in our system. And we're not unique. While we are not meeting the national average, we are similarly situated with larger cities who have constraints with cost, price, housing, size of housing, which sometimes prohibits us from allowing kin to move in.
Which is another reason we need to increase those subsidy rates, I would argue. In fiscal year 25, there were 527 families in the grandparent and caregiver program. And in fiscal year 26, there were 449. What's the reason for such a drastic shift in
Sure.
participation?
Sure. Not too drastic. About 69 children age out of the program each year, and each year, yes, and about 11 on board each month. So we are seeing children aging out at 18 in our population, and we're also seeing newcomers coming in.
Okay. So you would say the reason for that shift is families aging out?
Aging out and the rate of families coming in, yes. So we average about 11 children coming into the program each month. But yes, I would say.
And right now, there is not a waiting list for the program?
No, there's no waiting list. And I'm catching a text from the side that said we also have a host of families who failed to recertify for the program.
And what's that about?
Could be many things. It could be they no longer want to be part of the program, but if they don't recertify annually, they can no longer be part of the program. They have to verify.
Their outreach to say, hey, you're gonna lose your.
Yes, of course. Yes,
Okay.
of course. 60 days prior to, again, something we walked through after hearing the testimony, their specialist assigned to their case does outreach and not only calls, text, phone, email, snail mail, you name it, to say your certification is coming up.
And we're certain that all of those specialists dotted their I's, across their T's, and that there's not a gap in communication somewhere.
I have high confidence in those specialists. I can't say the word certain always, but I have high confidence that we are taking all efforts to ensure that if families are interested in recertifying, that they do.
Okay. And is that communication also electronic to those families?
It is their choice. So at this point, they would have had an established relationship with their resource development specialist. So if they prefer text, they'll text them. If they want email, they'll email or they'll call.
Okay. I guess for your sake, I would want an electronic record. Because if someone's saying, hey, I text them and they didn't get back, it's hard for me to verify that. if there was an email or some type of paper trail, you can at least go back to say, yes, my people, I have these dates, these times, they've actually communicated with them, even if that's not the preferred method. So just food for thought. I think perhaps we can do a better job of documenting that outreach.
Understood.
You mentioned in part, as part of your testimony for a legislation seeking to increase the subsidy, that it might result in a waiting list being created for the grandparent caregiver program. But how is that possible if there are now fewer families involved than there was in fiscal year 25?
Because it could mean that a family went from $15.92 to $38, and that delta, that difference is pretty impactful to the budget.
You mentioned in your performance oversight responses that some kin caregivers are denied being licensed as they have criminal charges that deem them as a safety threat to children being placed with them. What kind of charge deems a person unsafe?
Physical abuse to child, murder, egregious crimes that are not safe around children.
Is there a threshold? So does it have to be a violent crime that disqualifies me or any misdemeanor?
I'm going to turn it to Ann.
A history of violent crime or actively on probation now. So if there's a current.
Those are the
open
two
case.
categories. History of violent crime, which means you've had a crime that falls in the crime of violence.
Yeah.
Or you have an active probation case. Understood. Are there I'm sorry?
Sorry, those things are waivable. So like it is part of the assessment. And if someone comes back and says, a few years ago, we did have a grandparent who had a very violent crime, but it had been 35 years. People felt like she was really rehabilitated. And we were able to get a waiver from the director explaining through our assessment why we thought this was in the best interest of the child, and that can go through. So there is still a waiver process. Even with that on your record, we continue to have conversations.
Okay. Are there charges that CFSA will allow someone to have while still being licensed as a caregiver? And I'm assuming that's anything that falls out of the category of a crime of violence, or if you don't have probation. What if, now, and when we say charges, I'm assuming you've been adjudicated and found guilty of a charge. That's what, not that you are.
Criminal record.
But if, let's say you went to court and they said you're not guilty, that would not prohibit you from participating.
Yeah, so we ask for an FBI clearance, which would have all your convictions on it. We also do get a local police clearance, which might show some arrest history that did not lead to conviction, but we won't deny anyone based on arrest history that didn't lead to conviction. It's just part of the assessment we're doing.
And how far back do you look when considering a criminal record? Is that
18th birthday?
18?
Yeah, the Adam Walsh law is a federal law that requires that to be for caretaking of children in foster care.
Okay. Is there a rehabilitative pathway for those who may have had a criminal charge, let's say 15 years ago, but now they are redeemed and maybe in a very different place in their life?
Yes, absolutely. CFSA is committed to working with all families, so we want to get the clearances to have conversations to know what we're dealing with, and we absolutely.
So I may, let's say, had a violent crime offense on my record 15 years ago. I still can work with you all potentially and get a waiver.
If you're a DC resident, yes, we can do a waiver process through the director.
And that's at your discretion?
Yes.
That is, yep,
Based on a case-by-case basis?
yes.
Okay.
It is rare, but it has happened.
And this comes up all the time. Can you just speak to the lack of parity between the grandparent and close relative caregiver programs and the foster care subsidy rate? Like, why would the foster care subsidy rate be so much higher than these other rates. I think one witness said we're raising the same kids generally.
I do understand the concern, and I did hear it every single time. We, again, have not raised our foster care rate or our grandparent rate for a number of years. And they are raising the same child. The needs are the same. I'm not saying they're not. But this is where our budget falls at this time, and we're not able to increase rates for either.
Yeah, I will say for those in the public, the legislation that we moved, I want to say it's like $7 million. There's some obscene amount of money that it takes even to increase the subsidy rate.
$7.82 million.
It's about $7.82 million. Not to say we shouldn't do that,
Yep.
but that we also have to find that money. And there are any number of competing interests. And so it is my goal to work with you all to have more parity between those programs over time.
Understood. And I'd like to say publicly that I appreciate the grandparents and the caregivers. It is admirable they're stepping up for their family.
Okay, my team is just flagging that your answer here, which I'm going to take as your honest answer, is a little different than your written answer. So your written answer says there are significant differences between the roles and responsibilities of resource parents and participants in the caregiver programs besides taking care of the children. Resource families are subject to an extensive home study, fulfilling ongoing licensing requirements and participating in agency-led case management activities, including but not limited to frequent home visits. By contrast, caregiver program participation requirements are limited to an application process and clearances. Given these differences, CFSA believes that differentiated payment is warranted. So I'm going to assume you didn't write this. And I think it's frankly a little tone deaf, whoever wrote it. And I just would agree.
I do stand behind that response. I do. The question was, does it cost more to raise a child and grandparent caregiver versus a child in a foster home? No. No, it doesn't cost more. The cost of raising a child is expensive. If you are a licensed resource parent, we are doing weekly visits. We are in your financial business. We are doing a complete home study. It is much more intrusive as a traditional foster parent.
You would have to agree that our subsidies should be designed around the needs of the child and what it takes to provide for that child, not to compensate a person for their inconvenience.
That is true. And so our resource parents must prove that they have financial means before even becoming a resource parent. So it's not that they are relying on the subsidy to fund their home. Where our grandparents don't. They have to show that they have in poverty, 300% level of poverty in order to receive a subsidy.
That's even more the reason why there should be parity, or in fact, a reverse, where the grandparents should be receiving more than the foster care parents, because if they are employed and they're receiving a higher rate, that just further highlights how there is an injustice there. Again, I would love to work with you all on that, but if I have a high schooler and I'm a grandparent, and I have a high schooler and I'm a foster parent, both of those kids are requiring similar expenses and needs. And I just find it hard to justify that because one parent has a few more meetings a month, they deserve exponentially more money. I will move on, though, for the sake of time. In your performance oversight hearing responses, you make mention of CFSA doing an internal review of the caregiver program. When will this analysis be concluded and results available to the public for future or current caregivers?
So that will be in our annual report.
And when do we expect that?
It is due February 28th.
Do you anticipate that will be on time?
I surely hope so, yes.
Awesome. CFSA is currently not in compliance with 21 DCMR 6103.3C, and you mentioned the reason for this being that CFSA's previous client database system did not allow for annual changes, yet STAND will. Okay, so now STAND is here. Why haven't the rates been updated annually yet, would be the question.
Yes, and it's back to building out. So with STAND, we launched in June, and June 16th to be exact, and there are several iterations to the system build out. We are still working through bugs that we have found in our system from our legacy system to this current system. And so while we had a plan, have a plan of our full launch of STAND to be completed by 2026, we are having to re-scope the work of the builders and to fix these bugs and address them. So there's not an effort to hide any information. We have to work through the system build out and
Is
ensure that
there an anticipated timeline we can expect that?
summer of 2026. And that is barring everything goes as planned, and it's not going as planned right now.
For the district?
Well, I can't speak on behalf of the district, just the
Well,
agency.
I mean, what do you mean by that? Or internally for CFSA?
So for example, we have 70 reports that are required. Some of the data we couldn't get you here today right now was because we are still working through data migration. Of the 70 reports that we need to build out, 32 are complete. We are still working through 38. But because of the bugs we found in previous iterations of STAND, we've had to pause and shift and shape our work and our build out.
I want to move to social workers.
Okay.
Give me 1 second.
Sure.
So a win, last budget season, we secured money as a committee so that you can provide incentive pay. You've been able to staff up with social workers. Can you just speak to the hiring you've been able to do over the last year?
Yes, first, thank you for that. It did increase and entice people to come to our doors, as well as changing the pathway and allowing for bachelor level social workers to apply. Since October, we've been able to hire 19 social workers using that incentive, all of which will go to CPS and a few to Ann's area. While these individuals are still in training, we are excited about the new hires, and they will support reducing the caseloads that we know are a little higher than we would like.
And what is the subsidy that you provided?
They receive $2,500 within 4 to 6 weeks of employment, and whatever comes first, 6 months or September 30th, they'll receive the remaining $2,500.
Nice, nice. Okay, and what is the management and oversight structure of social workers look like?
Sure.
And by that, if you could just walk us through it, and we've talked about this a little bit behind the scenes. I get to hang out with you all regularly, but I'm really interested in the teams that are interfacing more directly with families and young people.
Sure. So each manager, there are 5 social workers that report up to 1 supervisor, and there's typically a family support worker on that team as well. That supervisor reports to a program manager who oversees the entire program. There's an administrator there as well, and then the deputy director.
So 5 reporting to a manager.
1 supervisor, yes.
And 1 support. So that's 6 people reporting up to that 1 manager who then how many clusters are there? So I'm assuming there's 4 or 5 clusters.
4 to 5 per program manager. They're responsible for 4 to 5 social workers. And then the administrator is responsible for all the supervisors in that area. Supervised program managers in that area.
And then what does the quality control look like?
Sure. Weekly
More so
supervision.
top down. So how can you, director, or you, deputy director, ensure that your directors or social workers are carrying out like quality activities with our young people?
Sure, I'll start and then I'll turn it to Ann since all the case carrying social workers are under her purview. So weekly, I meet with the executive leadership team that includes all deputies, HR, and our information technology part of our agency. So we meet every Tuesday at 10 o'clock to 12 o'clock and discuss agency-wide issues. Allows us to update. The teams in turn meet and share that information with their managers. In addition, I meet monthly with all managers on, again, happenings across the agency, things that we believe are important for them to know. And then supervisors meet weekly with their frontline staff. And you asked quality control, they should be having supervision on a weekly basis to discuss the cases, but also to discuss permanency. What are the barriers to moving these families along? What are their case plans?
So the manager is weekly shadowing one of those 4 or 5 social workers?
Not necessarily shadowing, but meeting in office
I see.
about their cases. At times, managers do
How
go out.
often, if ever, are team members directly engaging with family members? Because it seems to me, it seems more internal. So your team is reporting like, oh yeah, this is going great. Like, how are we getting feedback from the family or the young people to say, actually, it's not going great?
Mhm. So a couple of different ways. We have our Older Youth Council at the Office of Wellbeing, our Office of Older Youth Empowerment, where our children or young people in care share their feedback on our social workers and our processes. Thank you. We also have Ann, who hosts monthly sessions where foster parents, resource parents can come and share their feedback on how our case caring social workers and our teams are doing. We also have our quality service review process, which is an entire unit which picks cases at random and interviews the entire case, whether it be the school teacher, the principal, the bio mother, the youth.
And where
picks-
does that team sit, that
They sit
quality?
in the Office of Planning, Policy, and Program Support under Dr. Brandy Nicole Brooks. So they sit in the part of our agency that is responsible for our federal reporting, but also responsible for quality assurance
And
across
so
the
they
agency.
may contact the manager that says, at random, we want to learn more about this young person. So would they then go out and just shadow that young person in their interactions with the social worker?
They would hold an interview with each stakeholder in the case. So they would look back 6 months from the point of review. So if we're reviewing, let's just say May, they look 6 months prior to May to ask how they felt the services, were they appropriate? Are they the right fit for the young person? Are they getting whatever it is their case plan says they need? And are there areas of improvement for the agency? And this is, again, interviewing all members of the case. And this happens with CFSA and NCCF, our private agency partners.
So how internally do you deal with complaints? If a family or a young person says, I'm not satisfied, or I'm not receiving the supports, because that's what we hear. It doesn't happen all the time, but we hear at times, I'm supposed to receive X, Y, and Z supports, and I'm not getting it from my social worker.
Sure.
Or my social worker is not consistent in doing whatever this thing is.
Sure. So similarly to you, it doesn't rise to the level, my level often, but when it does, I will turn back to the deputy and say, hey, we need you to look at this. This is what I'm hearing. I take all concerns and complaints seriously, but I don't assume that I don't just make the assumption that they're not receiving whatever it is or that they are receiving whatever they're saying. I leave it to the team to investigate and get to the bottom of what the constituent is saying.
Okay, but is there a process that the team follows? So I'm clear that the Ombudsman office, they have their process.
Yep.
But okay, a complaint comes in, and what is the process internally for CFSA?
Internally for CFSA, if a complaint came to me.
Or let's say it
not
likely
me?
didn't come to you.
Okay.
But I don't know who a family would reach out to most likely outside of the social worker.
They would elevate it to their supervisors. They are very good about elevating
Okay,
to
so let's say
supervisors.
the complaint comes to the supervisor,
Mhm.
then what happens?
The supervisor would meet with the social worker and try to understand what the family said that they're lacking or not meeting their needs and try to resolve it first at that level. There have been times when families elevate higher than that, and it gets to the program manager, the administrator, and sometimes the deputy. I would say most times at the supervisory level, they are able to resolve. Many times there are valid complaints and lack of communication, or sometimes I just need a listening ear.
People drop the ball.
At
In
times.
an agency, you're not gonna have
At times.
you're not gonna have everybody doing everything perfectly.
At
So
times.
I would be surprised if there were no complaints.
Yeah.
So it sounds like those supervisors conduct an investigation of sorts and they run it up the chain as necessary.
They do, and they walk through with a social worker, maybe different strategies to communicate with the family or different avenues of support if that is what they're lacking in. Yes, of course, we do refer them to the OFC if we are still unable to resolve their complaints. They do know that Mr. Thomas he sits in our building. They can call him, go to him anytime.
How many complaints have you referred to OFC in the last year
Are you saying me personally or the team?
or the team?
I am not sure. I don't have that information, but I can survey the team and get that
OFC,
to
do you
you.
all have a number?
We don't have a number, but we do get complaints from the hotline report. They contact me directly.
That they're calling to complain about CFSA and CFSA is saying, hey, they're complaining about us. Okay, that's good to hear.
Yeah, again.
Accountability.
Thank you. No, what I would say is we are not, even if they talk to me at times, they may not be satisfied with the response. And so they elevate it. Sometimes they elevate it to you. Sometimes they elevate it to EOM. They're welcome to elevate it. Again, we are here to try to figure it out for the families.
Okay. I want to get a better grasp of that. And I mentioned that I would love to shadow social workers. I want to get a better sense of like, what are these interactions? I've heard from OFC that there's documents missing sometimes in the system. Not surprising. I'm a former teacher. Sometimes teachers didn't do their lesson
Yeah.
plan. It happens.
Yep.
It shouldn't happen, but it happens. And so I guess again, the question is, what is the agency's response in those instances when protocol is not being followed so that young people aren't on the receiving end of bad service?
Of course.
Yeah. In your performance oversight hearing responses, you say that staff shortages for social worker impacts a worker's ability to fully complete steps of an investigation. If the steps for an investigation are not fully completed, how does CFSA know that the investigations are being properly conducted?
Sure. And so we do have a staffing shortage, and I have been very public about that in our CPS side of the house. Currently, their average caseloads are 18, and that is with 45 social workers. So it is not necessarily that we skip steps. I will always, always, always prioritize safety over documentation. And if it takes longer to get to said, following every step, we will do that. So I have faith in our investigative processes. Now, there may be times where they may not close in a certain in 45 days. And as long as we are following and ensuring safety, that is at this time okay until we can bring
So
our social workers.
each of those social workers on average are carrying 18 caseloads.
That is correct.
What should it be?
The national average is 12 to 15 from the Child Welfare League of America is a comfortable average across all case carrying social workers.
Now, the 19 social workers you hired, are some of them going to be for the CPS team?
And about 90% of them are going to CPS.
Great. So this problem will hopefully be resolved. over
Yes,
time.
and the first group will be out of their training cohort around March, so we will be able to start to assign them more cases.
Great. And will that impact screen outs from the hotlines too, or no?
No, because they would get the decision after the hotline had already made it. They would get the case after the
Understood.
hotline made
Come
it.
into the hotline.
I understand.
Yes, but this is helpful. So right now we have 4 to 5. They have about 18 per person caseload, and there's about 19 more social workers coming on board, many of them for this team.
I believe 14 of them are headed to.
And that will drop ratios to, I'm assuming, that range where it should be.
Yeah.
About 12 to 15.
Yeah, I mean, it depends on our intake, but I just wanted to correct that screen outs. But decisions at the hotline has no indication regarding our staffing. So we don't screen things out because we're not staffed up. That doesn't play in any decision making whatsoever.
Okay. That's good. That's good. OFC made a number of recommendations for CFSA based on specific case examples and investigations conducted by their office. This is part of their annual report. Can you please provide an update on CFSA's implementation of these recommendations?
Sure, I have reviewed their report, and as OFC did speak to the fact of we do collaborate. We meet regularly. I did share their recommendations. Many of them, which you noted, are for training, especially at our front end of our house, our CPS. So we have shared them and do take them under consideration. I do think, again, anytime we walk through and maybe not always disagree on their findings, but if the recommendation is to look at our training calendar, curriculum, if they're finding things that we are missing, open to building out training to address those needs.
Can you pull it up? The cases? Yep. Give me 1 second.
Sure.
So I'm looking at OFC's annual report. They gave several, in Appendix 2, starting on page 33 of that report, they gave several case summaries. They also made a list of recommendations. At the end of it, CFSA's response, these findings and recommendations have been sent to CFSA and OFC is awaiting a response. Same is true for case summary B. Same is true for case summary C. And for those interested, this annual report from OFC can be found on OFC's website. So there are a number of recommendations under each of these. I'm just gonna at random choose some of these recommendations from OFC for looking at case summary C. That social workers and supervisors review, receive enhanced training, and ensure future compliance outlined in district code. That CPS social workers and supervisors review, receive enhanced training, and ensure future compliance regarding the hotline procedural operations manual. And this is, I know this is gonna, I'm gonna take the time to do this. So in this, the findings, the mother had a longstanding pattern of neglecting, abusing, and discontinuing care for a biological child. The youth's adoptive parents and current custodial guardian were unable to provide care due to multiple behavioral issues. Consequently, CFSA contacted the mother to informally care for the youth. The mother consistently demonstrated a lack of willingness to care for the child. She had relinquished parental rights to 10 years prior. The mother frequently communicated with CFSA expressing her desire not to continue caring for the youth. The behaviors of the youth began to escalate to the point of becoming increasingly dangerous. CFSA did not provide appropriate resources or support and refrained from petitioning the court for the youth to enter care. During the investigation and from March 23 to July 2024, approximately, the paternal grandmother was the legal custodial guardian for the youth. The youth resided with a grandparent in DC approximately 2 years prior to July 2024. On July 22nd, 2024, the parental grandmother filed a petition with another jurisdiction's court system for the relief of custody of the youth. Throughout the course of the investigation, it was alleged by caregivers, court staff, and law enforcement that the youth had documented mental health issues and did not participate in psychotherapy with a private counseling agency while residing with the mother. The youth was known to be regularly non-compliant with medications. DC law enforcement was frequently dispatched from July to September to the mother's home. I'm skipping ahead. During the at-risk FTM held on September 12, 2024, the caregivers present expressed their adamant decision not to provide care currently or in the future for the youth and stated their intention to proceed with terminating all custodial rights at the upcoming hearing in October. During the FTM, it became evident that the mother would be incapable of providing long-term care for the youth. When she agreed to care for the youth, she shared it would be temporary and she would require additional support. And then they provide a list of social workers. I guess the concern elevated in this case summary is that you have a young person in harm's way, not receiving needed mental health supports, ongoing trauma. The parent is saying, I don't want to take care of this young person. And even despite the grandparent pleading for relief, it alleges that CFSA failed to take action. Now, I don't want you to speak to the particulars of this case for obvious reasons, but they also then give a number of recommendations. I'm not going to read all of these, but some of them. Largely center on training, but compliance with internal procedures and DC code. But again, there is no response. So where, Director, are we with the findings in these case summaries that I thought were some of the most compelling pieces of information in OFC's annual report?
So I don't have a response to the findings today, but I am aware of all of these cases. These are cases that they elevated at the time to the previous director and I. This has been a case, without sharing too much, that we've been aware of for some time. And yes, the grandmother did step up to support and did step in until she wasn't able to. And we do try to put all services and resources in place for any family, including this family. And that's where I'll stop.
Is there a commitment to get a response to these 3 case studies to OFC?
Yes.
On their recommendations?
Yes.
When can we expect the response?
I will commit to the end of the month,
Of February?
February 28th.
Okay. Why don't we say March, end of March? Since the other things are by end of March, if you get it by end of February, great. But we're going to give a little extra time.
Thank you.
End of March. And the committee will love a copy as well, just to see what actions, internal shifts you all are willing to take. Can you describe the investigative process that CFSA uses when a child fatality does occur while a youth is in the agency's care?
Sure, I'm going to turn to Deputy Mafaleto. When we learn of a fatality, it's normally through a hotline call. And so our hotline receives the information. It is assigned to an investigator on my team. It's generally an immediate response, generally on scene. We're usually called by the Metropolitan Police Department or Children's National. Best practice is to send 2 social workers out to respond to the fatality because of the nature of the call and just the activities surrounding the initial investigation. We also, in our new stand system, once it is input into the system and identified as a fatality, there is a listserv that stand alerts certain levels of management. Office for Family and Children is also on that alert, and they receive an email that a fatality has come in and investigation has begun.
And what about instances where the child may die later, that there is an injury of sorts and perhaps that child is in the hospital for 2-3 weeks and then sadly they die?
When we find out about that at the hotline, so all fatalities are supposed to be called into our hotline, then an alert will go out, an additional alert will go out
So
because.
you wouldn't be notified until they actually passed?
So
Or
it
would-
could be either or. It could be a near fatal, an incident where EMS was called on scene, their child has suspicious injuries, is being rushed to the hospital, and then a day later, 2 days later, the child may succumb from those injuries. And then we have an internal process where the assigned social work team is to contact our hotline so that we can document it and send the alerts out to the appropriate people to include our internal child fatality
Is
committee.
it not the expectation of our public safety officials that they have to call in any instance when a child is involved in any type of traumatic event?
It is my understanding, yes, as they are a mandated reporter. We have some rare instances where a fatality has occurred and the responding officers didn't call it in, and it's more of a communication issue. I will tell you just from my own experience being on scene at a fatality, the amount of people that are there, it could be that, you know, an officer thought that his partner was going to do it or somebody else was. And so it's very rare, but sometimes we do get calls after.
But you're
the fact.
talking about a fatality. I'm talking about police show up to a domestic violence incident and the kid has a black eye.
Yeah. If they're mandated
They
reporters.
should be
They
calling
do.
you all about that as well.
We get calls from them all the time, but schools are our number one reporting source and MPD is our second.
Okay, you noted in your performance oversight hearing responses that in 2025, there were only 4 maltreatment fatalities in the district, and that CFSA was aware of 2 of them. Can you please share more details on why you only knew about 2 of the cases?
Meaning that they came to we were aware at some other point in their life, they had called or had contact with our agency. So the other 2, we had no involvement. We'd never received a
That was the
call.
first time you were
Yes,
learning
that
about.
is correct.
I see.
So I also just want to flag that these are cases that have been determined to be related to abuse and neglect. That is not the totality of all the fatalities that we investigate.
I got that.
So, right.
So there were only 4
That were
fatalities the result of abuse and neglect.
correct.
But a kid could have died from a drug overdose per se.
Correct, or
That
an
wouldn't be in that.
accidental injury.
That wouldn't be in that number.
Co-sleeping is our number one.
Got it.
So in FY '24, we received 64 death notifications.
Hmm.
And we reviewed 100% of those cases through child fatality in '25. We received 75 child death notifications.
And what are the trends that you're noticing?
Older youth, violence, gun violence is a trend we're noticing. We are seeing co-sleeping also as an indicator. Co-sleeping, so parent and child are sleeping in the same bed. Parent unfortunately rolls over or child suffocates.
Anything else?
Those are the top 2 contributors.
Do you have a breakdown of numbers along those? Maybe not.
I can get you a breakdown
Okay.
of these numbers,
I
yes.
just were curious. And hopefully that top line incident of older youth dying to violence is on the decline,
Yeah.
given what we're seeing across the district. All right, let's move to screen outs. What was the total number of hotline calls in fiscal year 25?
Okay, let me
And
get
we
back
haven't
to
even
that.
touched on education yet. I told my team,
That's shop too. so-
I told my team, we're gonna deprioritize education. We're not gonna deprioritize it, but
The total number of calls to the hotline in FY '24 were 30,882. In '25 were 25,409. And in '26 to date, 7,934.
I'm just trying to reference that based on what I'm looking at.
And I'm reading from question 39.
Okay, give me those numbers one more time.
Sure, in FY '24, 30,882. FY '25, 25,409. And in FY '26 to date, 7,934.
And how does that current number compare to 25?
I would like to give a sound answer, but again, we are working through data migration. But again, we saw a slight dip from 24 to 25. But in order to look at the first quarter, I'd have to get back and spend a
But
little more
in
time.
this window of time, are you on track to surpass it or fall below?
It seems as though we're on track to be around the same.
Around the same.
Mhm.
Based on your pre-hearing responses in fiscal year 25, 21,535 calls were marked as having no allegations. What does that mean? Is that the same as screened out?
Yes.
Mhm.
So just for your awareness, FY '24 numbers are from our old system, from our faces. And the FY '25 and '26 numbers are being pulled from the migration from stand to stand. And so if you notice some of the, and I think it's in the footnote that some of the allegations have changed, like the
Titles, I would drop it down.
the categories have changed a little bit.
I got it. So how do we screen in more of the calls?
I'm not sure I understand your question.
So let's take 25. 25,409 calls were made. And 21,535 were screened out.
Because they don't have an allegation. It didn't meet the threshold.
I think that's probably more likely that you all are determining that doesn't meet your threshold.
Those.
But I guess I just want to push on that because I would happen to guess there has to be credible allegations somewhere in 21,000 referrals that are being washed out.
So those also, that number is not just all screen outs. So that's how it's categorized as a screen out because we're not having an investigatory response. Some of what falls under this bucket is also all the reports that we get for non-caregivers that are sent to MPD. I'm sorry. It's okay. All of those reports that are abuse and neglect regarding our non-caregivers, we forward those to MPD. We may have non-investigative responses that these referrals go to 211 for our warm line. So we have a bucket of.
So let me ask it differently. How do we empower you all to investigate more cases?
Well, we wouldn't want to investigate a family that there's not an allegation of abuse or neglect.
But there are. In 21,535, I'm sure there are allegations of abuse. You're determining that it just doesn't meet your criteria. So my push would be, well, how then do we empower you to investigate more or shift your criteria so that you catch more cases, not for the sake of investigating and traumatizing families, but as the OFC case summaries allude to, there are instances where referrals are being made and they're being screened out.
So I can't speak to that report directly, but I can say we have guidelines that by law would determine what constitutes abuse and neglect that guides our practice. And I would be concerned about going out to families' homes and over surveilling them and investigating them because of what a perception that abuse and neglect is occurring and we're not investigating.
I would like to point out also that the national average of screened-in calls across the nation is 29%. So again, we also heard testimony that it is very invasive when we come into your homes. We heard testimony that is traumatic. It is. It is. Child welfare, child serving agencies are no place to raise children. So it is not our goal to bring more children into care unless it meets the threshold of abuse and neglect.
And so I'm looking at your fiscal year 25 rate is about 85% screen outs, which would put you at roughly 15% screen ins. So you're even below that national average.
Mhm.
And what I'm saying, again, I don't want to traumatize families. What I'm getting at is I think you all are missing some young people in harm's way. Why does this matter? Because if we don't act, obviously the worst could happen with
Right.
some of these young people. But also we talked earlier about crossover youth, and we know that this trauma is a leading indicator for young people to be on a different path in our criminal justice system later. So I guess the question is, how can we ensure there's earlier intervention by the agency that's meant to intervene?
Yep, and I can speak to that through the work that we're doing through the Warm Line. So my Office of Hotline and Investigations and the Office of Thriving Families, for which the Warm Line falls under, have had a partnership for the last 2-3 years, for which when we have families that come to the attention of the hotline for a tangible need, say food, housing, clothing, utility assistance, but it doesn't meet, it's more of a concern regarding poverty and not abuse, not something that the parent is being neglectfully holding food or holding housing from the child. We send those referrals to the Warm Line. So the Warm Line follows up with those families specifically that are our screen outs. So that is the prevention work that we are doing at the
You
hotline
say you send them to the hotline, is that
to the Warm Line.
to the Warm Line, like, here's the number for the
No,
Warm
no, no, no,
Line?
no. No, we have a referral process for which we obtain, for confidentiality reasons, not all the information that we receive at the hotline, but we provide identifying information to the Warm Line directly. We have a business process through QuickBase. And now Stand, I think. Yes. Close.
So let me ask it again.
And so there's a whole
How do
referral
we
process.
get that number of investigations up?
But I
And
got,
maybe you all are saying you don't want to investigate more.
We
And
want
I
to follow
totally
the
agree-
law.
I totally agree with your premise that we want to keep as many families connected
Mhm.
together. I'm there.
Mhm.
We also want to make sure that we are kicking the tires on referrals and allegations made.
and we are, I mean, that is what my hotline is designed to do. I have licensed independent clinical social workers who manage the hotline, who review those reports and determine whether
I just
they.
respectfully, I just think there's more that needs to be done. I don't doubt that you all are working very hard, but I even go to the educational neglect.
Mhm.
We know that that's happening. We know it. The data is clear, and yet there you're screening out all of these referrals for whatever reason. I feel like we're missing something in that process. And maybe there's another layer before a formal investigation that can take place outside of the hotline, where CFSA is at least making sure there is not a credible threat to a young person's well-being.
I'm committed to looking at alternatives, but we do have to follow the law in the structural decision at the hotline level. But I am committed to
And
seeing
the
if
law
there,
being what?
what guides abuse and neglect and what constitutes abuse and neglect. We can share, definitely will be more than happy to
And
share
that's
that
based
with you.
on our statutory definition of abuse and neglect,
That is correct.
which we're updating. So I would even, okay, let's give a very specific example, and I hate to go here because, so the whole, in the exposure to domestic violence, there was a lot of discussion about that. Some would say that's harmful for a young person over a long period of time to be exposed to domestic violence. I think everybody's in agreement.
Yes.
But all hell broke loose when we wanted to formally say that in the statute that that was abuse. Everybody said, no, 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 no. Let's actually not say that in the code. We follow up on that elsewhere. Or at least that was the testimony that we heard. I think from the OAG's office and others, that we actually can get at that without it being a statutory requirement. But what I'm hearing you say is that if it's not a statutory requirement, it just gets screened out and it's out in the wash. So let's use that as an example. Someone calls in and says, little Johnny is watching his parent be abused every single night, month in, month out. Per our statute right now, that wouldn't be screened in.
Yeah, that definitely would be a screen in all day, every day.
It would be
Yeah.
screened in. But under what legal definition?
So we have someone contacting our hotline indicating that a child is in the presence of a caretaker who's being physically abused, and that child is present, and there is risk for danger for that child. So that is a screen-in. So there's a difference between being able to screen something in for investigation and substantiating a parent for abuse and neglect. So I think that is the
That is a
difference.
fair distinction. Okay, that is helpful. So, but you're saying your screen out tool is based on the statutory definition of neglect and abuse. And what I'm saying is that, which I agree is harmful, is not written in code, that it would constitute neglect and abuse. And in fact, we were trying to write it into code and got a lot of pushback on it.
So I think it would be helpful if we shared the screening tool that helps the investigator. You'll see all of the types of allegations that we look for when a caller comes in. And it's the domestic violence, it's the physical abuse, it's the mental abuse. And there are certain narratives that the hotline workers are able to refer back to, like, oh, this is definitely an example of a child being exposed to domestic violence. This child is being exposed to sexual abuse. So the code helped us to determine that guide as to whether we need to screen something in to investigate.
So for every allegation of sexual abuse, let's
Mhm.
use that, for example,
Mhm.
is that automatically screened in?
Well, I think that's hard to say that
Because
not every
when I look at-
allegation of sexual
When I
abuse.
look at the data, you are screening out allegations of sexual abuse.
Correct. And that could be because it's a non-caretaker, and that's going to MPD. So the screen outs don't mean that nothing is happening. And I think that is what the perception is. Our screen outs are all of those referrals that get called in for sexual abuse on a non-caretaker. All of those go to MPD and are investigated by MPD. That is included
But
in
why
that.
wouldn't CFSA also take that on as your responsibility to see, even if this is a non-caretaker,
By law, we're not able
but
to.
is the caretaker aware?
So
the
that-
caretaker complicit?
So that is an allegation, and that is something that we explore in sex abuse when a caller is calling in on sex abuse. If we feel that the caretaker is involved or is failing to protect that child, that is a screen-in. But if it is,
Just go with me for a second. Why wouldn't we do a joint investigation with MPD? All right, MPD, you investigate this non-parental figure, and we'll go over here and talk with the parent or guardian, and then we'll meet up and compare notes. But what we're gonna do is ensure that any allegation of sexual abuse with a child is being pursued very aggressively. When I look at screened out calls and that's the allegation, it's like, oh my God, we're probably missing so many credible instances of harm for children.
I would disagree.
Okay, so you can say with certainty that every screened out allegation of sexual assault.
We cannot, CFSA cannot investigate the sexual assault of a child unless it's related to sex trafficking. We screen in sex, that is the only
Okay,
allegation
let's
that.
go there. How do you know it's sex trafficking?
Based on the report.
But what if they don't use those words, that this is sex trafficking? Well, all they know, based on what they see, is, I believe this young person is being abused It's not
Yep.
their parents, but we believe they're being abused. If we don't investigate that, how do you?
That's a part of our screening process. So nobody's gonna, I'm sorry, a layperson wouldn't call in and say, I think that Director Torres is being sex trafficked. What they do is call in, and most of the time it is from the schools that say, I'm a little bit worried. Tanya's coming in. She's got brand new shoes on that are that are expensive. She's coming in with designer clothes and bags. She's sleeping in class. She's dressing differently. Like our staff are trained to pull out from the reporting source
So
what
from
they're
that
concerned
example,
about.
you
Yes.
then will
Would
deduce,
screen that
okay,
in.
this could
Yeah,
be
a
sex
Yeah.
trafficking.
What
And
you're
we
describing
would-
is sex trafficking.
And we would investigate that.
Yes. Yes.
But a mere allegation of a child being touched inappropriately by a family friend when the child was at their house would not be investigated.
That would be investigated by the Metropolitan Police Department. And if MPD goes out and says, wait a minute, we have information to say that the parent was complicit, then they call us immediately and we go out and do a joint investigation.
And you're confident that those cross lines always happen? That CFSA every time is saying, MPD, investigate this, and MPD is always saying, CFSA, here's what we learned.
Yeah,
We're confident that's happening.
We have a communication process and a relationship with when we send over referrals, so we send over all of our abuse and all of our physical abuse and sexual abuse referrals. They sometimes review it and say, this is not something that would meet the criminal standard. We are what they call TOT, turn over to CFSA for investigation. If we go out there and say the report just says, Johnny came to school and said that he was disciplined by being punched in the stomach by dad for whatever reason, no marks or bruises. We go out there and the child is covered in bruises. We're calling MPD to say what the face of the report is not correct. And we feel like you need to come out and investigate this with us based on what we've seen. And MPD does the same with us. It's a reciprocal relationship.
And then I come back to quality control.
Mhm.
So a lot of this is also reliant on the call takers.
Correct.
How accurate they are, how attentive to detail they are.
Yep.
And which is another reason why it seems like we could be missing credible cases. Now, this is not to say this is your fault or shame on the agency, but what I am suggesting is I would like for us to be more sure that we're not missing instances where a kid has been traumatized, because there are so many examples of that.
And I will say, just to answer that question, we do have a CSTAT survey that was implemented this past year that callers are able to give it's almost like a satisfaction survey. And any referrals in which they're not satisfied, our supervisors review those and determine whether a call needs to be called back. We also have a QSR process similar to case carrying, in which we review calls and meet with the social worker and provide, or the hotline worker, and provide feedback.
And the referrer knows the outcome of the case, or no?
No, the referrer will, in our new system, in STAN, it will allow them to see the screening decision, but as far as the outcome, that's a confidential.
So I go to another example. I won't give particulars, but I personally received a call. I actually saw it on social media where a school leader is saying, we've been calling CFSA.
I was involved. I know exactly what you're
We've
speaking
been
of.
calling CFSA for help, and they refuse to help us.
That is not accurate information.
Okay.
The director contacted me, and I looked into it. We had screened it in, we had sent somebody out. So it was the perception of that reporter
And it's
thinking that
because they aren't getting
they're,
feedback. They don't know what's coming out of their referral.
but unfortunately for confidentiality reasons, they sometimes cannot know.
And that I do understand.
But we receive reports like that. I mean, I receive reports like that all the time from the director, and I check into it, and it's because they don't have the information or the social worker's not standing there in their face that they feel like CFSA is doing nothing.
Okay. I would just say again, I want us to look at the hotlines
Understood.
and the screen in and screen out process. Same is true for educational neglect. for these numbers, I'm just gonna give these numbers. For fiscal year 24 and 25, there were 6,430 screened out educational neglect referrals. And there were only 7 substantiated educational neglect referrals across those 2 fiscal years,
No,
per the data we're looking at.
I don't, if you,
Maybe I shouldn't say substantiated. There were 7 screened in calls.
no.
Okay.
Can you tell us what number you're looking at so we can be sure we're looking at
This
the right
was a
thing?
follow-up email sent by Nicola Gray
Nicola? Okay.
with a data chart for educational neglect. When I look at school year 25 and so maybe that's the thing. This is based on school years.
Oh, yes. So, this is based on, so if you look at that chart, you're in 41, correct?
Yes, it
Okay.
is 41. It is.
So
yes.
the number 7, that is, that had cumulative absences 0 to 9. If you look at the total number, we screened in 302
Oh, I
referrals,
see. I
total
see.
in that school year. And so far this school year, we have screened in 132.
And have screened out 1,568.
Correct.
We go over this every time. So I just. And I get what you're saying. You don't screen it in because a kid not showing up to school does not rise to the statutory definition of educational neglect. Then I say, what is the statutory definition of educational neglect? It's real fuzzy. It's real subjective. It's also worth noting, I tried, I think my first year on the council, to define educational neglect. Again, all hell broke loose. No, let's not do this. So again, I'm not in the business or interest of separating families, but I do think we need to take more seriously the trauma that kids are facing. We know we have a truancy issue. We know kids are not showing up to school. We know parents are not forcing kids to show up to school. Now, that doesn't necessarily mean it's neglect. I heard from one parent where she said, I don't know what to do. I'm asking my kids to go to school. I think they're going to school. They're sneaking back out. I totally get all of that. I think they're ready for us to go. They're kicking us out. Sorry. My point here is I do think it is a worthwhile exercise, and I would love a commitment from you all to look at the criteria to say, how do we make this more flexible so that we can actually account for more instances? If you are an elementary or middle school kid and you're missing 20+ days of school, I would be shocked why you're not on this educational neglect screen-in call.
And I will say, and I'm not sure if we have the data, but we have, that is why we started our Engage program. And I don't know if you recall what we do with those referrals, the Engage referrals.
Remind me, I'm sorry.
So those referrals they come through our screening our portal. And we have 4 days to determine whether it should be a screen in or a screen out. Sometimes we meet with families and more work needs to be done, but it's not an instance where we would find the parent neglectful. It's circumstances outside their control. They're having issues with housing, transportation, communication with the school. We assign those referrals that need additional support and prevention and to prevent an educational neglect investigation. They are assigned a family support worker that works with them and the school to ameliorate the attendance issue. And so we work with the family for up to 30 days. If the attendance issues continue, then we will screen that in for an investigation. If we're able to help resolve the family, then we close that out.
I'm with that.
Okay.
I'm with that. I like that.
We send a lot of we send a lot of those.
I like that, but at least you all are working with the family to
Right.
say, hey, this is serious. Your kid needs to go to school.
I think Deputy Meffiletto made a previous statement that I want to restate again. The perception is we do nothing with many of these screened out, whether it be ed neglect or referrals to our hotline. We make efforts to connect families when we can, if it doesn't rise to the level of abuse and neglect. But your question was, will we commit to looking at it? Of course.
Yes.
Of course, because I am at the table, we are at the table every time trying
Can
to.
follow up. I would love to go through the criteria. Again, the goal is not to harass more families.
Yep.
And I'm sure I'll get hate mail like, oh, you're trying to rip families apart. No. I believe there are so many of our young people in harm's way that are going under the radar. And then they end up in the criminal justice system because nobody came to help them when they needed help the most. I'll get off my soapbox. I'm going to end here with collaboratives, just for the sake of time. And I'm getting the death stare over here to my right. Collaboratives. We heard a lot of compelling testimony from our family success centers and collaboratives.
Yes.
And let me just say, I appreciate their work. I found their testimony compelling. While I can't vouch for all of them, I believe they are doing generally quality work, good work.
Absolutely.
I would also say, I think we are expecting them to fill the gap for the ways in which government and society is dropping the ball in a number of ways. How does CFSA track the effectiveness of our collaboratives?
Sure. So our collaboratives are under a contract. So they do have KPIs that are monitored on a monthly basis through the Office of Thriving Families. In addition to having to report out through, they have their own data tracking system, which they spoke about during their testimony. They are required to then send said KPI data to CFSA and meet on a monthly basis with a deputy over that area.
And how are we managing the quality or the reliability of their data systems?
Again, through regular meetings. So their system has been established for quite some time, and we have not had issues with their data, nor reason to believe that it wasn't quality that they were providing.
Okay, at the previous performance oversight hearing for public witnesses, the committee was made aware of data, oh, we just spoke about that, sorry. It's getting late. How does CFSA help ensure that folks can successfully graduate out of receiving services from a collaborative? Something that stood out to me and what I heard in what I heard in the testimony was that there were repeat visitors or I don't want to call them customers, but constituents that regularly are coming back for help, which is what I mean by we're expecting them to do what society or government isn't doing. But like, how isn't the goal for folk to be more sustainable in the long run, that our collaboratives or family success centers should be providing case management support so that people can get on their feet and live a thriving life?
Yes, that is a goal, but I would also say the value of the collaboratives is they have been in the community and part of this system for 30 plus years. And so you asked, is it the goal for them to graduate out of?
No. In terms of a constituent. So, and if I'm visiting
Yeah.
the collaborative every week for food or housing support or you name it, 3 years in, if I'm still doing that, to me, that just seems like we're spinning our wheels. And there probably needs to be more intensive support provided to that person so that they're not just coming back every week for the same support.
I understand. Yes, and I would say that the collaboratives work to connect with the DHS, for example, for TANF, or DBH for mental health or behavioral health needs. Again, I would say both the family success centers and the collaboratives are there in support of the community on a walk-in basis or referral basis from the 211 Warm line or from our hotline. So the goal for every individual is different. They set their case plan, their plan with their collaborative worker. And sometimes it takes 3 years, sometimes it's quick and their needs aren't as significant. Again, I do value the collaboratives and what they bring to the table because they do serve sometimes in the gap.
1000%. But I would want, and we heard testimony about this housing support, and I think maybe some of them have small pots of money that they can use.
That is correct.
My immediate thought was, well, then why wouldn't we tap our collaboratives into the DHS ERAP portal and have those systems talk to each other? Why wouldn't we connect the collaboratives with external social workers that are trying to get people housed in long-term supportive housing. And the list goes on. Like, how can we move the collaboratives to thinking more sustainably about the services that they're providing so that they can keep doing it, yes, but that the people are actually able to soar?
So again, each collaborative is different and they offer different things. I would say that they do think about sustainability. They do build, for my knowledge, their own networks outside of CFSA. They do work very much in the community with other community providers. A lot of times we do use the collaboratives from the 211 Warm Line to the collaboratives because they have knowledge that sometimes we don't even have. So I do think that they are thinking long-term sustainability beyond government. And each of them brings something different to the table. And I would have to, I can get you each of their focuses, but I do think they're thinking long-term. And I do think that they serve an important role in our array of
agree.
services.
I agree. I'm not suggesting they don't. I'm thinking more about the people they're serving. But one of the things that came out crystal clear was that our collaboratives and family success centers need more resources, need more money, need more support. Now, I know that might be a discussion for the budget, but what is the agency thinking about in terms of better supporting, funding, resourcing our collaboratives?
Sure. At this time, we are operating under our approved budget. As Ms. Bussey Reeder said, it has been flat for the last, I believe, 3 years, and we will continue this year with that flat budget. So again, we are going through the budgeting process like everyone else, and as those numbers become final, I can share more, but at this time, we are operating under a flat budget for both the success centers and the collaboratives.
I got it. I hear that, but that's not what the people on the ground are saying. And granted, I know that's not solely your determination, but again, my soapbox, I think we just need to think more comprehensively about a lot of these programs. If they are on the ground doing the work that so many other programs are promising to do, why wouldn't we streamline support into our collaboratives and family success centers or tie them into other programs more efficiently? It will be something I'm looking at and seeing how we might get more support to the collaboratives through the budget process. In your performance oversight responses, I noticed that community flex funds for fiscal year 26 have not been spent. Why is that?
Because we did have the spending freeze, and there was a delay in getting them to the vendor, East River. So they are now there and underway. Contract is good to go. So we did not have any expenditures in Q1.
But you are now able to spend
Yes.
that money.
Yes, we are.
And families are referred to various collaboratives for services. I'm assuming based on their expertise or the services they provide is how you're determining
Where they live.
and where they live.
Mhm.
I got it. In your performance oversight responses, you note that referrals to collaboratives decreased in fiscal year 25, while pointing to the 211 Warm Line as the reason why. Is this because families are now connected directly to the collaboratives, or are they going elsewhere for support?
Both and. So previous to the 211 Warm Line, we saw more walk-ins to the collaboratives. And now we are seeing that more people are calling 211 Warm Line. And sometimes the referrals, they are referred to the collaborative, but they are also referred elsewhere in the community for supports.
So we are seeing an increase.
A decrease in the collaboratives numbers, especially our walk-ins, but an increase then on.
But you would say those is the 211 Warm Line sending people to the collaboratives?
100%. So for those that need a little more than a connection or a referral, and probably the people you were just talking about are staying a little longer, they are referred to the collaborative for case management.
Does CFSA believe there are redundancies between family success centers and the programs that CFSA offers?
No, we do not.
How do the Warm Line, collaboratives, and success centers work together?
Sure. So the Warm Line is a referral resource for district residents. So again, if there are the 10 family success centers or neighborhood-based programs, They receive a small pot of money from CFSA to provide certain things depending on the collaborative, and I'd be happy to get you a list of their focus areas as well. If they have those tangible needs, live in that area, the 211 warm line will refer them to the Family Success Centers. Again, if they have longer-term needs, but it doesn't rise the level of abuse and neglect, they have issues of poverty or issues finding stable housing or needing employment, we will refer to the collaboratives for case management. So success centers do not have case management responsibilities. They are more of the neighborhood-based, one-stop, come in, learn about, what is that? Tangible, thank you, that's a good word. Get tangible items or come to parenting classes where the collaboratives assign a case manager and follow that family, are with that family and walk them through various.
And we also heard
Yeah.
testimony that reimbursements have been incredibly slow to the collaboratives that are already operating on tight budgets. It sounds like that may be an issue you all have worked out as you had a meeting and now reimbursements are moving. Is there an expectation for reimbursements moving forward for the collaboratives?
There's never an expectation of delayed reimbursement. In this case, and the one that was spoken of, we did have some back and forth with invoicing and proper documentation, and all that takes time. And in 2025, we did increase our scrutiny of all invoicing, and so that does take a little bit longer, but no, we never intend to delay payment for
And so
proper
what is the
invoices.
expectation for turnaround? Is there like within 15 days, 30 days?
I believe the district has a 90-day,
90 days.
I'm hearing 30-day
30
turnaround period from.
90 days.
See, this
Jesus.
is why I got this team there.
Okay,
keeping me
30
together.
days
Yeah.
from receipt of the invoice.
Proper invoices. So a lot of times we were finding that documentation wasn't accurate, or we're resubmitting a document that we already paid on.
And when you go back, does the clock reset?
The clock
So,
starts at when we have all documentation in order. So not from if you emailed me last Tuesday and you gave me incomplete documentation, but it took you to Thursday to get it current, I'll start Thursday because now we have everything we need to send it forward.
got
for
it.
payment.
And you're clear, the collaboratives are more clear on the documents and data they need to provide.
I am very clear. Deputy Simmons back here met with them as well as his monitoring team to ensure that if there were any gaps in our support to the collaboratives, they were addressed, as well as what we were looking for from them was made pretty clear.
Pivoting. After several years of decline, CFSA's most recent performance oversight data shows that in fiscal year 25, the percentage of children experiencing 3 or more placements during the year jumped back up to over 30%. What are the reasons for this increase?
Yes, this is, again, I spoke about it in my testimony. Placement instability is something that we are experiencing on a pretty significant level. We are having children who are coming with, again, severe behavioral and mental health needs, and we are having parents who, in addition to the world stressors, just are not able or unable at the time to care for the children, so are asking for them to move.
What are the steps you all are taking to reduce these multiple placements?
Yep, so we, again, strive to place our children in the placements of families that are able to support them. But again, we are having a shortage of resource parents as well. So in addition to supporting our resource parents through their resource parent support worker, which they have in addition to their social worker, to help them through some of these challenges that they are facing, we are also focusing our recruitment efforts on increasing our capacity for our parents, because there is no secret, we have a shortage of DC foster parents. And I'd be remiss if I didn't say, if you're interested in fostering, please call 671-LOVE.
671?
Love.
Love. And outside of just advertising, are there steps that you're taking to increase DC placements?
Yes, the FAPAC, I spoke about that in my testimony a bit. We did enter, FAPAC has previously supported our resource parents through training, enrichment activities. Great partner. We actually entered into an increase their contract to focus retention of and recruitment of resource parents in the district. And a former resource and foster parent will be leading that work at FAPAC in collaboration with our teams, of course.
I would love to work with you all on that. And,
Very excited about that.
what is the status of the agency's efforts to reestablish the Bridge program, the 24/7 emergency placement resource for youth with high behavioral health needs that was formerly operated by Life Deeds.
I am so happy to finally report that we were able to open our doors in November of 2025. And again, it's been full probably since inception.
And can you just, for those unfamiliar, share about the Bridge program?
Sure, the Bridge program was stood up previously through another vendor who is no longer with us to serve as the place for children who were experiencing, we were experiencing trouble finding a suitable placement for, to give us time to assess what it is that they needed. It's so a bridge between coming into care at times or multiple replacements at times and longer-term placements.
Your performance oversight responses say that at least 27 referrals were made to DBH for evidence-based specialized services for children in foster care. How many of those children actually received the services for which they were referred?
I am going to turn to Deputy Director Gilbert. She has been here this whole time waiting for
I
this.
know, I needed to get a question answered.
I'm so excited. Actually, we'll follow up with DBH to get you the data for the
Okay.
follow-up because those referrals went directly to them. And so we didn't receive any reports that the service had not been provided. And usually we're able to find out if there's a
And
service that
can
they
you
don't have in
also
place.
follow up and just provide, if they were not provided, what were the barriers or the reasons for the
Absolutely,
services not being
Mhm.
provided?
absolutely.
What are your top 3 recommendations or systemic changes that you would like to see to improve access to behavioral health services for youth in care?
I'm sorry, could you repeat that? I would
Your
write that
top
down.
3 recommendations or systemic changes so that we can provide behavioral health for youth in care.
Well, I think a couple of those things we've been able to put in place. So one is that we've invested in our own internal mental health unit, which has been phenomenal, and that's been supportive. And we've also been able to do contracts in different states. So the state of Maryland, we've had a small contract. We've been able to expand our mental health array to serve children with autism. We've been able to actually do specialized services such as DBT, dialectical behavioral therapy supports. And so what we're doing is sort of structuring the needs of our children and families. The other thing that we've done, and actually we just set this up with Ann's team, is we are providing or expanding our services to post-permanency so that we are trying to prevent disruptions of adoptions and reunifications and things that have taken place. So I would say it's more about continuing to invest in the mental health or the behavioral health service array. That's important. The behavioral health support to post-permanency children and families is important. And then our continuation of our partnership with DBH, which has been phenomenal.
And I'd like to add too, I do think we need to continue to increase our system coordination across agencies to assess which programs are working, which programs are we as a system, not CFSA as a system, are working for our families. And that is work that is underway, but I do think needs to continue.
Yes, yes, which is in part why I'm interested in getting that information. And I will share it with the Committee of Health so that we can just triage across these two. Regarding Social Security benefits, conserved under the requirements of the Pocket Act, to what extent have youth who have exited or aged out of care been able to access those funds? And how much has actually been transferred to youth exiting care?
Yeah, so that's a loaded question. What we can share about the Pocket Act is that the funds, well, let me just start at the beginning a little bit. The Pocket Act requires CFSA to conserve Social Security benefits. And in order for youth to receive those benefits, when they exit care, it's important that they have a special needs account established through Shared Horizons, which is what we use. And it's also important that if we don't have those funds in the Shared Horizons accounts for a special needs trust, and if it's in a DC-able account and it gets a little complicated, that the funds must be returned to Social Security. And the reason for that is because CFSA is the designated payee of those funds, and they have to continue to be tracked even when youth exit care. So if it's in a special needs trust, the trustee is able to provide Social Security with the reports and follow-up and tracking of the funds that are being expended.
So it goes in a trust and the
They
trustee
can
can disperse those monies to the youth?
They will disperse those funds to pay for housing, supports, and needs in addition to funds to the youth. They can do that as well. And it's a controlled type of disbursement, which is required under Social Security regulations.
According to the 2023 Fostering Stable Housing Opportunities Annual Status Report, 18 out of 29 youth aging out of care were placed into short-term or time-limited arrangements like foster homes, kin placements, or transitional housing. These placements do not guarantee long-term stability and may mask significant housing insecurity risks. In addition to complying with the Pocket Acts, as you just spoke about, what mechanisms are in place to prevent youth from entering the homelessness system once temporary placements end?
Well, as you know, we work really closely with DCHA for the FUP voucher process. So we've been able to enhance that and actually strengthen that a little bit. So we've been working with them. So the youth are able to come to the attention of CFSA not come to attention, I'm sorry. The youth are able to come to the attention of our housing information sessions. We have those twice a month. And so that's sort of the jumping point for the whole housing review process, the needs the youth have prior to.
And then from
exiting
there,
care.
they apply for the voucher.
They can apply for the voucher.
They get the voucher.
And hopefully get the voucher, yes. And we have not had any youth that have been denied from the voucher or had not received the voucher. Now, we may have youth that are still waiting to be leased up, meaning to get the apartment, but we have not had any issues with the voucher.
And that's testimony that I believe I heard last year, that waiting time to get leased up, the voucher expires, or the voucher is not enough for where they desire or are being positioned to live.
Yeah, so we have to support the youth around expectations as it relates to the voucher and where they want to live.
I could also say we can't make landlords accept our vouchers, and that's a challenge.
Yeah,
Yes.
it is.
Okay, so maybe we'll add that as something to look at. For youth who enter transitional housing programs after aging out of foster care, what process or supports are in place to help them secure more permanent, stable housing? So you talked about the FUP voucher, but that's more so as they're aging out. So let's say I'm now aged out 2-3 years. Are there any supports or resources in the CFSA ecosystem to help them?
Actually, those youth, we have monthly meetings with the Homeless Council, TCP. So they're TCP, TCP. I may be having maybe a little confusing. But we have monthly meetings with them, and those youth are actually able to come back and still be eligible possibly for the voucher. So if the standards and regulations have changed as it relates to the FUP voucher. So if they've been 16 years or older, then they can be involved in potentially being reviewed for a new voucher to help support the homeless process.
Even after they've aged out?
Even after they've aged out, up till 24.
And who makes that determination?
There's a reconciliation process in the monthly report. In the monthly meeting. And so those youth are brought back to our attention, and then our aftercare program can work with those youth to apply for the voucher, and yeah.
I got it.
And I'd like to speak a little bit about aftercare. You said what's in our ecosystem in the older youth empowerment part of the agency. We do have a team that do support youth who age out of care for up to 2 years if they need help. So it's not mandatory. A lot of times we see our young people transitioning into unstable housing like you may have just talked about, but come back and want that support. So they're there for that at any time.
Sorry about that. Okay. I will give you the last word, Director. I'm wrapping up.
Everybody's smiling. I hear it. Including him, especially him.
What do you want to be true for the rest of this year? Or what are your goals for the agency as we approach yet another unprecedented year for the district?
Yes. What I want to be true is I want to continue to work towards retaining the team that we do have. I want to focus on our workforce and recruit highly talented individuals to come into this workforce. It is a very hard job, and If you are looking to be a social worker, please visit our website. We do have open positions. So what I want to be true is that we continue to be known for protecting and serving children when abuse and neglect is current, but also for keeping families together and working with the system as a whole to improve the lives of our children and families of the district. And that does include early intervention. So hopefully they don't even have to come to our care.
Awesome. Well, thank you. Thank
Thank
you for
you.
your ongoing partnership. And I want to thank also our Office of the Ombudsman, that's how I refer to your OFC, for being here today. The public record for this hearing will remain open to February 18th. If you were not able to testify as part of our public witnesses, or you heard something today and you want to weigh in, you can submit testimony to the committee directly by emailing a member of my team. And with that, I am going to adjourn this meeting. The business before this committee is being concluded. The time is now 5:47 p.m. and this performance oversight hearing is adjourned. Thank you.
Thank you.